I'd like to call this meeting to order of the Kingman Common Council on Tuesday, September 15th, 2020. Could we have the roll call, please?
Mayor Miles,
Present.
Vice Mayor Lingenfelter,
Present.
Councilmember Malouf,
Present.
Councilmember Nelson,
Here.
Councilmember Scott Staley,
Present.
Councilmember Watkins,
Here.
Councilmember Wade.
I'm here.
We have a quorum.
Yeah, so we have a quorum.
Yes, ma'am.
Okay. Tonight, our invocation will be given by Pastor Shaw of Trinity Episcopal Church. Thank you so much, Pastor.
Mayor, I do not have Pastor Shaw on with us.
You don't have him on the Zoom?
He is not connected.
Okay. Then I would just ask all of us to have a moment of quiet and reflection and prayer before we start the meeting. And if we could just join ourselves in that moment. Thank you. Amen. We now have the Pledge of Allegiance to our nation's flag. Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. The council may go into executive session for legal counsel in accordance with ARS 38-431-03A3 to discuss any agenda item. The following items may be discussed, considered, and decision made relating thereto. And the first order of business tonight is awards and recognition. And today we had the great privilege of giving a recognition and the key to the city to one of our citizens, Mary Chan, who is so deserving and has given to this city untiringly with all of her commitments to organizations, fundraising, contributions. You'll hear about it in the video. We did it this morning. I'd like to thank Councilwoman Malouf for helping coordinate all of it, and just everyone who participated, Colleen for taking the video. So I think I just say play it and we get to see this video. Is that right? Here it goes. Good morning. Today I'm privileged to be here to honor Mary Chan and give you the highest recognition that this city can, a key to the city of Kingman, to recognize your decades of contribution to the well-being of this community and its growth. Also, we're grateful to have several of your family members here, people who are here to celebrate this moment with you. And of course, because this gathering has to be small, we cannot have all of her grandchildren here. And I'm sure you would like that, your 5 grandchildren, and I understand one on the way.
Yes.
So, but I know that they will watch this video and everyone is proud of you. Also, we have several key community members here that are going to speak about some of their experience with you and your contributions. We have Mr. Brian Turney, the recently retired CEO of Kingman Regional Medical Center, Mr. Scott Kern, also of Kingman Regional Medical Center, and Councilwoman Malouf, who has been so instrumental in coordinating this event. So thanks to you. And they'll speak in just a moment, but first I wanted to mention a few things. I wanted to thank you personally for being a friend and a role model. In my experience, in every way that you have contributed to this community, You have done it with dignity and with humility and with concern and caring that was always very low key, but everybody noticed. So that's part of why we are here today. And from the early days when Centennial Park was being developed, and when you were contributing flags and benches and trees, and Locomotive Park helping to get the caboose, to the current days where all of your contributions to the hospital are going to be mentioned, and the other entities that you're concerned with. You've just been a role model of citizenry, and I appreciate that, and we all appreciate that. And that's why I'm very proud to present this to you. But before we do, I want to turn this over to Mr. Turney to say a few words about his work with Mary Chan. Brian.
Thank you, Mayor. Mary, it's an honor for me to be here and honor you. I've always admired you because you've been a person that's, number one, a person of action and a person of heart. And we saw that personally with our cancer program and also especially our hospice program. We have a hospice home that does not support itself and we need help, and you were always there. Year after year after year, you raised significant money. I remember sitting in board meetings and a couple board members would comment and say, hey, here comes Mary Chan. If she's coming, just get out your wallet. Don't argue because you're going to lose. And so anyway, I'll let Scott talk a little bit about the dollars that you raised over the years. But every year you were doing that. And this year, unfortunately, because of COVID, we couldn't have the race. But we were renaming our race the Mary Chan Race for Hospice. So, yeah. So in the future, you'll be recognized because of all the things you did year after year. Thank you for all the contributions, not just for KMC, but the community as well. So thank you very much.
Thank you. We're honored.
Yeah, Scott?
Thank you, Brian. Mary, I've been working with you for 11 years now, and every year you have made the Race for Hospice better and better for us because we could always count on you for your contributions and going out and raising awareness through the community. So for that, we're always grateful. You have, in my time, I went back and checked my records, you've raised over $75,000 on your own with $50 checks here, $100 checks there. So that's pretty significant when you think about how small our community has been and how much it's grown. So we would not be where we are today with our race, with our hospice house, with everything our foundation is trying to do without your help and your support. So we appreciate you. We can't thank you enough for everything you've done, and we are so happy to have the race named after you moving forward. We can't wait to give you that first shirt next year and have you start the race for us. Thank you for everything.
I am overjoyed to be here to honor a woman who has long deserved a key to the city of Kingman. Mary Chan is the most loving, honest, authentic human I have ever had the pleasure of knowing. Mary has generously given to and done so much for the city of Kingman, from her fundraising expertise and her God-given gifts of charm, poise, charisma, and gab. From selling tickets for events and raffles, far too many to count, walking, running, and participating in almost every charity event, sharing your history, Mary, and giving your talents freely without hesitation or expectation. You are the gold standard in friendship. Mary knows I call her my angel, and she is definitely a treasured friend. And Mary, knowing you has enriched my life and made me a better person. And I'm just thrilled that you're going to be receiving the key to the city of Kingman. Thank you.
I think that all of us know that words cannot express the appreciation that we truly feel, and it's echoed throughout this community. And so I'm sure if this were not a COVID time, we couldn't have it here. We'd have too many people wanting to celebrate you. But right now I'm just going to take a moment and get this plaque, and Sue Ann and Brian, if you'd like to come up and just stand with us and as we present this. Mary, this is the key to the city of Kingman, Arizona, presented to you, Mary Chan, in honor of outstanding philanthropy and untiring commitment to the city of Kingman. You are an inspiration to all that know you. Thank you for making a difference. And that is given to you this day, September 15th, 2020. Thank you.
Thank you very much. Thank you from the bottom of my heart. I
You are
appreciate
welcome.
that.
Would you like to say anything?
Well,
Or- You're welcome to say something.
okay. Well, first of all, and it's a really surprise and honor, and to accept this key of the city, and I really appreciate that. And I just wanted to thank you from the bottom of my heart, and to everyone. And thank you very much.
Thank you.
Uh-huh.
That was a lovely moment for all of us, and look forward. I hope we can have lots more of those lovely moments with our citizens, and someday without wearing masks. The next award, or really recognition, is a proclamation that was requested by the Lewis Kingman chapter of the Daughters of the American Revolution. And this is a short proclamation recognizing Constitution Week. And so I'll read this, but then we will make sure that it is delivered to this group. Last year I was able to read it to them in person, and I'm looking forward to that again. But tonight, whereas the Constitution of the United States of America, the guardian of our liberties, embodies the principles of limited government in a republic dedicated to rule by law. And whereas September 17th, 2020 marks the 233rd anniversary of the drafting of the Constitution of the United States of America by Constitutional Convention, and whereas it is fitting and proper to accord official recognition to this magnificent document and its memorable anniversary, and to the patriotic celebrations which will commemorate the occasion. And whereas Public Law 915 guarantees the issuing of a proclamation each year by the President of the United States of America, designating September 17th through 23 as Constitution Week. Now, therefore, I, Jen Miles, by virtue of the authority vested in me as mayor of the city of Kingman, Arizona, do hereby proclaim the week of September 17th through 23 as Constitution Week, and encourage all citizens in Kingman, Arizona to join me in this worthy observance. The witness whereof I've hereunto set my hand and caused to be affixed the seal of the city of Kingman, done at the city of Kingman this 15th day of September 2020. It is signed, and Annie will make sure that proclamation gets to the right group of people.
Yes, ma'am.
Thank you. And then the next proclamation is regarding National Literacy Month, and this was requested by the Kingman Area Literacy Program. I think Erin Roper runs that group, and maybe be a speaker later, but we're very happy to do this. I remember working with this group in years past. And the proclamation is, whereas literacy is the single most effective way to promote global prosperity and eliminate poverty, and whereas cultures that are literate embrace the key lever of change for economic development, social growth, and environmental protection, and whereas cultures best promote and support democracy, political stability, and peace based on many factors, but rely on a pivotal factor, literacy. And whereas assurance of literacy for all citizens best promotes peace, human rights, environmental protection, and prosperity, and whereas literacy brings improved self-confidence to the individual, a heightened sense of belonging, and improved job opportunities. Now, therefore, I, Jen Miles, by virtue of the authority vested in me as mayor of the city of Kingman, Arizona, do hereby proclaim the month of September 2020 as National Literacy Month, and further declare September 8, 2020 That has passed now, but it was International Literacy Day. I strongly encourage each of us to recognize contributions made by Welcome and other literacy organizations, such as our local literacy program, CALP, Kingman Area Literacy Program, for the significant contributions that they have made and continue to make on our community and citizenry. In witness whereof, I have hereunto set my hand and caused to be affixed the seal of the city of Kingman on this day, September 15th, 2020. So thank you, and I'm sure you'll get that to Erin. Annie? Thank you. Okay. Okay. The next order of business is call to the public. And since this is a virtual meeting and in-person attendance is suspended for this meeting, if we're holding it obviously through technological means, and residents wishing to address the council during the call to the public or on a specific agenda item could either submit written comments or register to speak on the telephone. And all of those comments and requests to speak had to be received by 9 a.m. on September 15th, 2020 by emailing cityclerk@cityofkingman.gov or dropping off handwritten comments. Or email, and those wishing to address the council by telephone also needed to follow those protocols to register with the city clerk. Apologize, I'm having to turn this page. Only those that are pre-registered will be admitted to the meeting. Each speaker will be given 3 minutes to comment, and then they will be removed as to move on to the next speaker in the queue. A total of 20 minutes is allotted for the call to the public portion of the agenda. All comments will be shared with the council and made a part of the public record. Actually, tonight, I think we only have one person that is signed up for the public comment, and that is Amanda Kaufman. Is she in the meeting?
Ms. Kaufman has been admitted.
Good evening, Ms. Kaufman. Could you please give us your name and city you represent, and you have 3 minutes for your public comments.
Hello?
Hello, Ms. Kaufman. This is Jen Miles.
Yes, I'm sorry.
You have been
Amanda
admitted to the-
Kaufman. Yes, Amanda Kaufman. I'm at 3824 Pack Saddle
That's
Road here
okay.
in Kingman. Hey, good afternoon, Mayor Miles and Council. I just had something quick here. On September 1st, I had brought up to the Mayor and the Council's attention that the repeated responses from the city attorney indicating the city code had conflicts and was not updated in conjunction with the state statutes. He's been saying that on some of these statutes, or some of the city code, if you will, for about 6 months. Can you please have it updated and brought to the council for review and adoption, and somehow make this a priority? It will help keep the operation of the government transparent, and it would reduce the speculation and confusion which is continuing today. That's all I have.
Thank you. That concludes the comments from the public. We'll move on to the consent agenda. All matters listed here are considered to be routine by the City Council and will be enacted by one motion. There will be no separate discussion of these items. If discussion is desired, the item will be removed from the consent agenda and will be considered separately. Do any of the councilors want to remove any of these items from the consent agenda? I'm not hearing anyone wanting to remove them. So I would entertain a motion to approve the consent agenda, items A through G.
Madam Mayor. Oh, sorry, Ken.
Sorry. I would
I would recommend that we approve the items that are on the consent agenda as listed.
Thank you, Counselor. Is there a second?
I'll second.
We have a motion and a second to approve the consent agenda as presented. All in favor, please say aye. Aye.
Aye.
Aye.
Aye.
Anyone opposed, nay? Ayes have it, motion carries unanimously. We have no old business this evening, so we'll move to the new business. And the first order of business is amended, our council ratification of emergency proclamation / mask mandate. This is council discussion and possible action on emergency proclamation mask mandate. Current COVID-19 data to be provided by Mojave County Public Health Director Denise Burley. Kingman Regional Medical Center will present the efficacy of masking for COVID, flu, and other droplet diseases. And since this is the item, since this is my item basically, what I would like to do is I've prepared some remarks, and I would like to give my introductory remarks to this item. Then we'll hear from our presenters, and then we will hear public comment. These are the normal protocols. And of course, there will be council questions and comments to our presenters. Then we'll hear public comments, and then we'll go to council discussion. So that's how we'll approach this item. And so I'll start with my opening comments. Good evening. Tonight, I ask the City Council to support and ratify the proclamation I issued requiring people to wear face coverings when they enter places of business unless they are exempt. This proclamation is intended to be in effect until the end of the year in order to maintain consistent use of face coverings, a protective measure that has been critical to driving down the cases and hospitalizations due to COVID-19. It is also critical to maintaining the low numbers we now experience during the upcoming fall months, a time when there are increased risk factors for disease, so as our schools reopen and there are increases in seasonal diseases such as flu. Combined with COVID outbreaks, these stressors could again tax our healthcare systems and the workers who have been our frontline heroes during this pandemic. And though we no longer have the COVID-19 surges that were happening in June and July, we need to do our part to keep our numbers low as possible and ensure that our healthcare partners, a few of whom will speak tonight, know the full support of this council and community. I believe that tonight the data will be clear that requiring face coverings to be worn combined with other measures such as hygiene and reducing gatherings is working. The case numbers and hospitalizations are dropping steadily. And as the numbers drop, some businesses that were shut down by the state's executive orders have been able to partially reopen. These business owners and employees have been and are struggling to survive, some of them, and I believe that we owe it to them to extend a mandate and maximize the odds that our COVID numbers will stay low and facilitate their return to a more normal operation as soon as possible. This council has approved a number of small business assistance programs designed to help their economic recovery. But I believe our best assistance now is to ensure people continue protective measures so that they can stay open. To remove the protective measures now is to increase the risk of virus transmission and to elevate concerns of people who want to shop and engage with businesses in a safe environment. I believe this will take us backward if we remove the measures. From the onset of this proclamation, there have been those that oppose this mandate, stating it is unconstitutional and illegal. I will leave that argument to attorneys and judges if and when it is litigated. In the meantime, I will continue to stand with the mayors of 90% of Arizona cities and the governors of most states in our nation who believe that requiring protective measures, including face covering mandates, help ensure citizen health and safety during a public health crisis. And they believe, as I do, that it is not only legal and constitutional, but ethically required for those of us elected to serve our citizens. I'm very glad to have kept this proclamation in place for 2.5 months with the administrative and legal support of the city. It was a critical time during which the spread has been slowed and in which businesses, schools, and the healthcare community have had time to assess, adjust, and establish new policies and requirements regarding pandemic protocols, including face masks. But this evening, it will be up to this council to determine whether the face covering requirements continue till the end of the year. I believe it is wise to do so. In order to build on the successful reduction of our COVID numbers in Kingman, let us acknowledge that we have come a long way in slowing spread. We are being successful in our efforts to contain the virus, but it is premature to test that success. I believe an important judgment that each council member tonight faces is whether his allegiance lies to a political position or with the health and safety of our citizens in Kingman, Arizona. We know that we're closing in on 200,000 people throughout the country who have contracted COVID-19 in the past months and have died, suffocating with what could, some say, be characterized as a preventable death. And by now, most of us know at least one or several people who have died or been very sick from this virus, and I know I do. But we also know, based on the history of pandemics, that this one will be contained and the need for mandates and protective gear will end. There is unparalleled investment in science to provide the COVID-19 vaccine, not only in America, but in many countries throughout the world. This investment would not be taking place if the pandemic was not real. The Arizona Department of Health Services, as I understand, is working to develop strategies to distribute vaccines when they're available. The potential for vaccine availability by the end of the year or early next year gives great hope that 2021 will be a time of recovery and renewal. Council, we, each one of us, feel strongly our responsibility and accountability to the citizens of Kingman. I never doubt that. But I personally believe our first priority must be to safeguard our community's health and safety. So for me, it is not a would you take. Well, you can wear a mask if you want. You don't have to wear a mask if you don't want. You decide. I think the citizens deserve a consistent policy and requirement that all of us, with the exception of those who have conditions that exempt them, will comply with a simple protective measure that has been demonstrated to save lives. In doing so, we align with our healthcare providers who serve all of us. In doing so, we support our schools as they reopen, sending clear messages to our students that we are all in this together and we are doing the right things to protect each other. And in doing so, we truly protect small businesses who can rely on a consistent message throughout our community that wearing masks protects each other and slows the spread. We need to have the fortitude and integrity to adjust and adapt during this pandemic time. It will come to an end, but while we're in the midst of it, let's do the right things to get every person we can to the other side of the pandemic. I'm unwilling to adopt the attitude that in order to get herd immunity, many can die so that others can be free of inconvenience. That is not the American spirit that I know and respect. We've come a long way. Let's maintain the progress and not jeopardize the success. The face covering requirement is working. I will vote to keep it going for the well-being of our community and to support our businesses in reopening and their economic recovery. And I hope you will too. And that is the end of my introductory comments, and I would now turn it over to our presenters. And this evening, Denise Burley, the director of the Mojave County Health Department, is the first speaker. Maybe.
Okay. Can everybody hear me?
Yes, hi. Hi,
Hello.
Denise.
Hello, everyone. Thank you. Good afternoon, and thank you for the opportunity to present this afternoon. I've been asked to provide some Kingman-specific COVID-19 data, and that information and that data, the graphs are included in your packet, I believe. But before I get started, I want to be clear about one thing in particular that I hope sort of sets the stage for my conversation and presentation, and that is that my lens for presenting today is protecting the public's health, nothing more. I look at that, that's my job, and it has no other agenda attached to it. I just want to make that clear, that's where I'm coming from. That's my lens. So in your packet, if you would pull out, there were 3 graphs, I believe, provided to you. Thank you. So the first graph that you see on the screen, that's our epi curve for the entire county. And as you can see, within that particular graph, we had a fairly nice upward trend starting, looking back, about the time the governor opened things back up again. We had the stay-at-home order starting, that ended about the middle of May. And then you started seeing an upward trajectory of cases about that point. And then right around the first week in July, I believe the city of Kingman put in their mask proclamation. And you would expect to see a continued increase. I know people will go, well, we didn't see a decrease in cases immediately. But keeping in mind, there's a 2-week incubation period. And then in addition to that, you have close contacts of those particular cases that end up being positive and have spread that virus. So you would expect a 2 to 4 week time frame before you started seeing a decrease in cases. So, and that's exactly what you start seeing here on this particular graph for the entire county. As all 3 cities enacted mask ordinances right around the same time, you started seeing a decrease in those, in the number of cases per week, until you get to just our most recent week, where we had, you know, a very, very low number of cases. I believe, let me see if I have that number. So for last week, there were 6. So I just wanted to point out that's the entire county. And if you move to the second graph, these are City of Kingman COVID recorded cases by week. And you'll see the arrow and the circle at the bottom around the date that indicates when the city initiated their mask proclamation. And you will again see that increase in cases. Sorry, I'm getting emails along the way here. You will see that increase in cases going up and then spiking the week of, it looks like August 1st, and then a very strong downward trajectory again to where we are today. And then on the third, what you're going to see is more of this particular graph, thank you, is about hospitalizations for all those that had a recorded address in the city of Kingman. So 99% of the cases would have gone to Kingman Regional Medical Center, but if they had been out of town in any of the other communities, they may have been admitted into a different hospital. So what you see on this is very similar, right? You're getting through and seeing some increases for 3 to 4 weeks, and then that downward trajectory again in hospitalizations. And we have seen a direct correlation in between the number of cases. When our cases were very high in our county, we also saw our hospitalizations very high. And the stress and strain that put on our hospital system as a whole was very, very difficult for those staff to address and to manage. And KRMC may be willing to or able to speak more to that when they're presenting. But there was a lot of stress. There was even a point at which one hospital needed to request staff because it was difficult to find staff to staff their actual hospital. And that is not something a road we care to repeat and go down again. So, I think what you're seeing is, again, a correlation between the timing of the proclamation in addition to other mitigation steps. I know there were other people there were businesses that were closed. I realized there were businesses that are now reopening slowly, but we're not seeing an increase in cases yet. So we're hopeful that those reopenings will also maintain slow case increases or no case increases if people are taking some of these preventive steps within the business and outside in the community. Any questions on the data?
Counsel, do you have questions for Ms. Burley, Director Burley?
Mayor Miles, I would have just a couple of questions, just to confirm a couple of numbers.
No questions? Vice Mayor.
Thank you. Just a couple of clarification questions to Director Burley. So in the data that you've provided, I want to make sure that I have it right. Do we have 491 cases that are attributed to Kingman? Is that number accurate?
Hang on. That's a different chart for me.
Sorry.
No, not at all. I didn't print out a data sheet. So let's see here. So the last, sorry, I don't have it in front of me right now. The last one I had was for September 13th in my possession, and right here without opening it up on my computer.
Yes.
And on that particular date, we had 490 cases that were Kingman cases.
Okay, great. And of our cases, I want to clarify the number of deaths. I've seen different numbers, but in the slide, it looked like 54. Is that wrong?
You know, no, you're doing pretty well. Let me again go back to my graphs here. So we've got, I believe that's right. That would be give or take, because the month of June, since we had less than 6, that data would be suppressed there.
Okay, great. I appreciate it. Thank you.
Oh, absolutely.
Any other questions? Thank you so much, Director Burley. Really appreciate the time and effort put into this presentation. I would say facts are friends, but that's those graphs are very helpful in seeing what's happening. So I'm going to go now to our KRMC physicians, and I think we have Dr. Swap and Dr. Matheny here, and I would ask, I think Dr. Swap is going to be the first speaker, or the speaker. Good evening again, Dr. Swap and Dr. Matheny. Thank you for being here, and I'll just turn it over to you, Dr. Swap.
All right, thank you, Madam Mayor and respected council members. My name is Ryan Swap. I'm a pathologist here at Kingman Regional Medical Center, and so I run the laboratory. I've been involved with the testing.
Then I'm Dr. Matheny. I'm the director of the critical care services and the hospital service, and also in chairing the clinical pathway committee specifically designed to make some COVID policy here in the hospital.
So we have a short statement and then be happy to answer any questions. So we appreciate the opportunity to present and share our experience regarding masking. From the outset, we'd like to distinguish between scientific data and public policy. We would like to present some objective facts, and what the council decides to do with that is a separate issue. Talking about the biology of the virus, it's transmitted primarily in a person-to-person manner, and it occurs in close contact with and true respiratory droplets. These droplets are small liquid particles that escape our mouth and nose while we're talking, while we're coughing, while we're singing, while we're sneezing. They're constantly leaving us. These small droplets, and the lighter ones, remain in the air for a long time. This is what's meant by aerosolization, and if the droplets make contact with other mucous membranes, they can be infectious. Droplets touching hands, which then touch mucous membranes such as the eyes or mouth, can likewise be infectious. The science surrounding masking is not in dispute. Masking decreases transmission of the virus, both by decreasing aerosolized particles that land on surfaces, which can also diminish contact transmission. This has been demonstrated both in laboratory settings and practically. Communities which masked early suffered a much lower burden of disease. And that's been really our experience in the hospital as well. As we've masked, we've seen a decrease of transmission, almost no transmission there. So again, we appreciate the opportunity to weigh in and provide you with some clinical information which might inform your discussion. We'd be happy to take any questions.
Thank you, Doctor. Do the council members have questions for Dr. Swap or Dr. Matheny?
Mayor Miles, this is Vice Mayor Lingenfelter.
Go ahead.
This is for Dr. Swap. So in various, I guess, simplified terms, what you just said was, and I'll use a bad analogy, and you can laugh at me if you want to, but if you had a fishing mask or a fishing net and you were to try to catch a bunch of minnows, the mask is basically the net, and the mask would catch the big minnows. The little minnows would maybe get through the net, but the theory is, when it comes to viral load, that if you catch the big minnows, then people will hopefully have less severe symptoms, less hospitalizations, less deaths. And is that accurate?
Yeah, I mean, I would say that masking prevents maybe most of the minnows, that are coming out. It's not going to be 100%, but it's going to be, this is all dose dependent. So if I'm sitting here with Dr. Matheny and he's got COVID, it's going to depend how long I'm sitting here talking with him in the same room. So the dose dependence issue is a really big deal, if that makes sense, council member.
Yeah, it does. And I've had discussions with my own doctor. Hopefully everybody's having discussions with their own doctor, and he's basically told me the same thing. So thank you.
Yep.
Yeah, what you may be getting at is the masks are not perfect, but in terms of protection, both the excretion of the droplets and the reception of the droplets are impacted. And the amount of virus that potentially is out there to be exposed to other individuals is exponentially decreased by the barriers.
Thank you.
Thank you. Thank you, doctors. Any other questions?
Yeah, I have one.
Who was that?
Councilwoman Malouf-Keener.
Go ahead. Go ahead. Oh, Councilman Keener, go ahead.
Okay, so doctors, you did say that masked communities have lower numbers from your research.
Yeah, much lower, and that's been now very well studied in a number of meta-analysis. Communities that instituted masks early, much less disease burden, much less transmission, much less mortality.
Okay, and if this comes back, with just the normal seasonal flu, and then if COVID comes back stronger in the fall, which is what kind of is being predicted, our hospital could potentially be overwhelmed if we just kind of aren't as careful as we could be with the masks. Is that perhaps a true statement?
Well, I mean, past its prologue, we know what we went through when we had our surges here and how it really impacted our capacity. The hospital did a very good job of being prepared for it, but it was obviously a big strain. If that were to happen again, we'd expect the same thing to repeat.
Yeah, I'd just like to add one thing. It's hard to prognosticate the future. Certainly that's difficult. But what's interesting, since these masking policies have been in place, influenza is likewise a droplet based disease. And so in the Southern Hemisphere, where it's their flu season right now, like in Australia, for example, they're seeing a remarkable decrease in influenza there. So their flu season has been very, very light. And it's hard to attach a causation to that, but certainly masking is probably helping them in that regard. So, we don't know what it will do for flu season either, but if often Australia predicts what is going to happen in the Northern Hemisphere 6 months later.
Thank you so much.
Thank you, Councilor Malouf-Keener.
Mayor Miles?
Any other questions?
Yes, Mayor
Councilor
Miles.
Watkins.
Dr. Swap, I appreciate you bringing that up because I was just thinking that theoretically it should hold true that by wearing masks because of the COVID thing, it should actually lessen the impact of our flu season this year too, as the numbers are showing in Australia.
Right.
So I appreciate you bringing that forward.
Yeah, being scientists, you know, the flu data and masking is not really out there. So these are anecdotal, you know, observations that people are making, but they're being published in the journals. We won't know till it happens, but we're hoping that may be the case.
Yeah, right. Well, thanks again for presenting tonight.
Thank you.
Thank you, Counselor. Anyone else? Dr. Swap, Dr. Matheny, thank you again so much for being here. It's so important to hear from you because you and Director Burley are out there dealing with this every day. And so we really appreciate your time. Thank you and your insights.
Thank you. Thanks for your service.
Thank you. So we've concluded the presentations, and so now we will move on to the public comments. The comments on this agenda item. And the first person actually to speak will be, again, Representative Gina Cobb, who requested it this afternoon. If she is online.
Representative Cobb has been put into the meeting.
Okay. Representative Cobb, you're in the meeting. You have an opportunity to speak with all of us.
Hi, this is just a second. Let me get you down here. Thank you so much. Are you there?
Yes, we are here. We can hear you.
Okay, I'm sorry. The *6 thing always throws me because it shows that you can unmute by your number and then all of a sudden the *6 thing goes. But thank you so much. So I just want to say, Mayor Miles on Council, thank you so much for allowing me to address the Council tonight. As you remember, I addressed this Council 2 weeks ago and read the AG's opinion, and I'm glad to see that the lack of following the statute is being addressed tonight and allowing the decision to be implemented for the mask that you had made the proclamation on to go to year 2021 to come to the full council, and I appreciate that being done. I also expressed concerns not only for the process, but for the actual mandate itself. I have received several communications pro and con. Again, I'm not opposed to personal choice for a mask, but I am opposed to the universal mandate without data to support, and I feel it was an arbitrary mandate. Let me give you some current data. I know you guys have had some current data given by the Department of Health Services right now, and but I also want to throw in some pieces that, you know, we saw the curve and how things went. Right now, we're at the lowest number of cases and deaths since the beginning of taking the data. We're at 484 new cases, and that was 9,651 that were tested. Our R0 is at 1.0 right now, and it was as low as 0.65. We've gone up and down for the last, but it's pretty much stayed right around 1 or below. Keep in mind that the mass shutdowns were meant to mitigate hospital capacity overload, which we have accomplished. In the Pennsylvania decision that the shutdowns are unconstitutional, the judge says, we're undertaken with the good intentions of addressing a healthcare emergency. The authority of governments is not unfettered. Judge Strickman added, the solution to the crisis can never be permitted to supersede the commitment to an individual liberty that stands as a foundation of our American experiment. He furthermore later on said in the Constitution cannot accept the concept of a new normal where basic liberties of people can be subordinated to open-ended emergency mitigation measures. I really oppose this, and I oppose the continuation, and mainly I oppose the length of the continuation. I feel that if we were to have continued it for a short amount of time, watched the numbers, and saw where we were going to be at, or decreasing it and watching the numbers, that would have been more acceptable to me, as it was the first two times that Mayor Miles did the extensions. But when we extended it to the year 21, that was where I felt like we are just arbitrarily doing it, and we're not watching the numbers anymore. We're not taking the data into case. What we're doing is just saying we are going to extend it to 2021. I know we're looking at this, and as a healthcare provider, I have issues, but at the end of the day, it's our liberties that are at stake. And I thank you all for allowing me to talk with you tonight and allowing me to express my opinion. Thank you.
Thank you. The next speaker that we have this evening is Erin Roper.
Ms. Roper has been admitted to the meeting.
Ms. Roper, welcome to the council meeting, and if you would please state your name and the city you represent.
My name is Erin Roper, and I've lived in the Kingman area since 2009. I'm here today in strong support of the mask mandate. Mayor Miles has shown immense courage, intelligence, and integrity by rising above political posturing and implementing the mask mandate for the health and future of our community. COVID-19 numbers are dropping in Mohave County in conjunction with the mask mandate, as shown by the data available in the county's coronavirus response hub. We have laws dictating food handling procedures, cleanliness in hair and nail salons, and licensing and education requirements for dentists and their staff. We have building and fire codes for commercial spaces. All of these requirements are for the health and safety of our community. It is evident that Mayor Miles understands that the mask mandate is in the same vein as these laws, and she cares for our community and believes in protecting the well-being and freedom of Kingman and its residents. Yes, freedom. To vote against the mask mandate, to claim wearing a mask infringes on a person's freedom, is to ignore the first and most important of our inalienable rights: life, liberty, and the pursuit of happiness. Since you can't see me, I will tell you I look fairly young and healthy, but I received a kidney transplant thanks to the generosity of my sister, and this puts me in a high-risk category. I'm at a much higher risk of dying from COVID-19 if I were to contract it, or having severe consequences if I were to survive, such as losing my transplant. In addition to the unknown number of people like me with serious medical conditions, 24% of Kingman's population is over 65 years old, according to the 2010 U.S. Census. These residents are also in a high-risk group. If you vote against the mask mandate, you are unilaterally devaluing the lives of at least a quarter of your constituents. You are saying we do not deserve the protection of our right to life. You are saying someone's minor inconvenience is more important than another's life. Now is the time to stand up for the well-being of the people and community you are elected to serve, to resist the unnecessary politicization of a public health crisis, and to demonstrate courage and integrity in the face of those who are trying to undermine our inalienable rights with false cries of unconstitutionality. I urge you on the behalf of your most vulnerable constituents to vote for the mask mandate. Thank you.
Thank you, Ms. Roper. The next speaker will be June Deering.
Ms. Deering has been admitted into the meeting.
Good evening, Ms. Deering. If you would state your name and the city you represent, please. And You have 3 minutes. Ms. Steering, can you hear us?
She's still showing muted, Mayor.
Oh, she's showing muted.
Yes.
I
Annie,
have
can you help?
request. Yeah. Oh, there she goes.
Okay. Good evening.
Can you hear me now?
Ms. Steering, yes. Please give us your name and city you represent and continue with 3 minutes, please.
Yes, I'm June Deering, and I'm from Kingman. Mayor and members of the City Council, my name is June Deering, and I am the Engineering Manager of Mojave County for Unisource Energy Services. Can you hear me?
Yes, ma'am. Keep going.
Yes.
Okay, thank you. As critical service providers at Unisource Energy Services, we feel we can't take chances with the health of our employees whose work keeps our economy moving, supports the work of our first responders, and makes our modern lifestyle possible. This includes our linemen, which you may see out repairing lines down after a storm or a hit pole, our engineers who go out in the field to help new customers get connected to our system, or our gas field technicians on the who come in and connect or reconnect customers. That's why Unisource has required our employees to wear cloth face coverings when working together as a best practice, along with the hand washing and physical distancing. Our company has provided cloth masks to our employees and their families and made fire-resistant masks available to our employees who work with energized facilities. So far, we've had no case of employee-to-employee transmission of COVID-19, and we credit face coverings and other CDC recommended protections for this success. Unisource's commitment to the safety extends to the communities we serve, which is why we support the use of face coverings in public during this pandemic. The requirement you're discussing today is similar to the rules our employees follow every day, rules that help us return home at the end of the day to our families and friends. Face coverings have proven to be effective in limiting the spread of the virus. The CDC has reported about a hair salon in Springfield, Missouri, where 139 clients were exposed to 2 hairdressers who had COVID-19, but wore double-layered face coverings at work because 1, the city required it, and 2, their company policy was such. And after all the contact tracing in 2 weeks, the follow-up, no COVID-19 symptoms were identified among those 139 clients. Because everyone involved wore a face covering, nobody else got sick. And that's the outcome we should all be seeking for our community. And I truly thank you for your time tonight. Thank you.
Thank you so much, Ms. Deering. Appreciate your time. The next speaker will be Mark Stiegler.
Mr. Stiegler has been admitted to the meeting.
Good evening, Mr. Stiegler, and welcome to the council meeting. Please give your name and city you represent.
My name is Mark Stiegler. I'm from Kingman, Arizona. Hello.
And you are, hi, Mark. You are on the council. We hear you.
Great. Okay, here we go. Thank you for this opportunity to speak. Let me be clear about who I am. My name is Mark Stiegler, and I am a libertarian who owns an arsenal that Dianne Feinstein would declare outlaw. I am a fierce champion of freedom. I am also a Silicon Valley research scientist who has studied viruses and epidemiology. Let's talk facts. COVID is 15 times as lethal as the flu and twice as infectious. It is especially lethal for people like my diabetic wife and my 87-year-old mother-in-law. We also know masks work. Not only do they save lives, Goldman Sachs research indicates that the reduction in lockdowns accompanying a national mask law would increase our economic strength 5%, a desperately needed boost. More bad news. Unlike the flu, COVID is spread by super spreader events, the viral equivalent of explosions. Even if we go a couple of weeks with no new cases, just a couple of super spreader events one weekend could overload the hospital 2 weeks later with no warning. Let's talk freedom. Consider an analogy. Do you believe people must be allowed to drive drunk, lest their liberty be infringed? We have universally outlawed drunk driving because it not only endangers the driver, it also endangers his passengers and all the nearby bystanders. The staunchest libertarians oppose drunk driving. Entering a public building without a face mask is similar to driving drunk. It endangers the maskless person, it endangers his family who will get it from him, and it endangers bystanders who may get it from him if he currently has COVID but does not know it, which will happen often since over half of COVID plague carriers do not know they are infected. Consider the numbers. Drunk drivers kill about 300 people in Arizona a year. COVID has killed 5,000. It would be safer to repeal drunk driving laws than face mask requirements. Finally, let's consider the real effects of masks on the future of liberty. For those of you who share my fear of the regulatory bureaucracy known as the deep state, the stakes are even greater. Please understand, the deep state needs masks banned. Why? The number of video cameras installed to watch over us grows daily. The number of cameras hooked up to AIs with facial recognition grows with it. Eventually, the government will be able to press a button and track every movement of every person, every moment we are outside our homes. Against this threat, a critical defense is masks to defeat facial recognition. We must exploit this pandemic to get as many people into masks as possible, to make mask wearing as normal as possible, so that when they come to take our masks, we recognize the threat. Taking our masks will be their last step before taking our guns. So to keep us all alive in the short term and to protect our liberty in the long term, we must support the mayor's proclamation requiring
Mr.
masks.
Steigler,
Yes.
your time is up, sir.
Stiegler.
I'm sorry.
Mr.
Yes.
Stiegler,
Thank you again.
Your 3 minutes is up. Thank you
Yes.
very much.
Thank you.
Okay. Our next speaker is Mark Niski. If I said that right, Mark.
Mr. Niski has been admitted into the meeting.
Good evening. Good evening, Mr. Niski. Please state your name and city, and you have
I am unmuted.
3 minutes.
Hello? I am unmuted.
Go ahead.
I am unmuted.
I think
You need to turn
off any other electronic device that is going on.
Okay, it's off.
Okay, you're good to go then.
Whenever you're ready, tell me.
We are ready. Please go ahead.
Oh,
and
thank you.
Tell us your name and city and 3 minutes.
My name is Mark Niski, Woodcrest Circle in Kingman. Thank you for allowing me to speak at this call to the public. I would like to take a moment to express my support for a mask mandate. I will not comment on the legality or constitutionality of this mandate, but ask the council to take whatever legal action is required to elicit that masks and social distancing are mandated and that within reason, it is enforced within the city's jurisdiction. We know that masks have a considerable effect on curbing the spread of COVID. Yet many oppose wearing masks because they view it as a personal choice rather than a public health issue. But this insistence on personal freedom ignores the fact that masks protect the wearer as well as those that come in contact with them. Mask wearing and infection rate is an inverse relationship. It follows then that the greater the number of people who wear masks, the greater the reduction in transmission. So the science is clear, but what about the philosophy? Are we giving up important personal freedoms when wearing a mask? This depends upon how you apply positive and negative rights. A negative right forbids others from acting against the right holder, while a positive right obligates others to act with respect to the right holder. But who is the right holder in the case of COVID? In a pandemic, an individual has a right to be able to prevent becoming infected. For an individual to argue that he or she has a right to not wear a mask implies that that individual has a right that supersedes the right of others to maintain their health and safety. Which is more important then, the right to be free from inconvenience of wearing a mask or the right to be free from infection? The science is sound. The recommendation is reasonable. Wash, mask, distance. It couldn't be easier. I am confident the day will come, and it won't be long, before we have vaccination and effective treatment regime, in which case I wholeheartedly support repealing these mandates. I have worn a mask for 42 years, with, as far as I can tell, no deleterious side effect. I would again like to express my support for a mask mandate, asking the Council to take whatever legal action is required to see that masks and social distancing are mandated and that within reason it is enforced within our city's jurisdiction. I thank you very much. My name is Mark Niski. Have a good day.
Thank you, Mr. Niski. The next speaker is Ethan Benson.
Mr. Benson has been admitted into the meeting.
Hello, can you hear me?
Yes, Mr. Benson, please state your names and city, and you have 3 minutes.
Okay, thank you, Madam Mayor. My name is Ethan Benson, Kingman, Arizona. I'm speaking today to ask this council to vote to end the mass proclamation tonight. Over the last 10 days, I've shared professional research, data, and analysis with the council showing that masks are not effective against viruses and that the basis for such mandates is unsound. Those who forget history are doomed to repeat it. The mask experiment was tried during the 1918 flu pandemic, and it was discovered then that they make things worse. After a round of mandates was shamed, fined, and otherwise punished those who did not comply. Over the last 100 years, the efficacy of masks has been meticulously studied. The results have always proved that they do not work against viruses. Back in March, all of our top health experts relying on decades of research and science advised against wearing masks. Then suddenly they reversed themselves and began demanding we wear masks without deciding any data to back it up. Swedish epidemiologist Anders Tegnell warned that because scientific evidence for mask wearing to prevent COVID-19 is astonishingly weak, it's very dangerous to believe that face masks on their own control the spread of the disease. He would know because his country has reached nearly 0 cases and almost nobody in Sweden wears a mask. I provide government source data showing that the places which implement a mask mandate have a huge spike in cases thereafter. This includes, but is not limited to, Alaska, California, Texas, Washington, and most notably Hawaii, which has high compliance due to harsh enforcement. Closer to home, our neighbor Yavapai County has fewer cases of COVID overall, despite higher population. Even with no mask mandates in most populous cities, Yavapai's numbers are declining at the same rate as Mojave County, proving that mask mandates are not the cause of the decline. The virus naturally surges for approximately 6 weeks and then burns itself out. The basis for the emergency proclamation is not sound. As of September 13th, Mojave County has about 3,700 cases, 1.76% of the population, and 206 deaths, 0.097% of the population, 74% of which are age 70 or above. This does not constitute a state of emergency and never did. The so-called positivity rate justifying restrictions is a completely fraudulent number based on the number of tests performed, when until very recently, only sick people were allowed to test. This is like looking for Trump supporters among known Republicans and being surprised by how many you find. Sweden and South Dakota both proved that draconian intervention by the government is unnecessary in dealing with this virus. Give the people facts, not fear and propaganda. Let them decide for themselves how to best protect their public health. Mask is a symbol of fear and oppression, and to maintain fear in the population and to continue the government's so-called emergency measures. Let's face the truth, the state of emergency is not about safety. It is about money that flows as long as the emergency is in place. As Chairman Bishop of the county board said, there have been quite a bit of monies available in Mojave County due to the state of emergency. The people now know this emergency is a sham, all public trust is gone, and a complete lack of interest and participation in this past week's testing blitz proves this. In the mandate now, let's start the recovery. Thank you, and God bless America. Thank you, Madam Mayor.
Thank you. The next speaker is Amanda Kaufman.
Ms. Kaufman has been admitted into the meeting.
Hello, Ms. Kaufman. Please state your names. City.
Good
and
evening.
three
Yeah, good evening,
minutes.
Mayor Miles and Counsel. Amanda Kaufman. I'm here in Kingman. I'm hearing a few people tonight support, continuing on the masks. And, I'm wondering, I have yet to see any studies on masks with all the rioting, all of the rallies, and even like Sturgis. There's been no real study on these mass populated events or explosions, as somebody said earlier. That is it just a coincidence that people are wearing masks and the virus really isn't there and it's going away on its own and the mask is just a coincidence? And I understand that these studies, everybody's done studies, the CDC has reversed itself several times, the WHO has reversed itself several times, our health department, our state, nobody really knows what's going on here. There's several strands. Last I heard, there were 6 different strands of this COVID, and the strand going around Kingman wasn't as fatal, if you will, wasn't as lethal as some of them. There's people being diagnosed as a death or having a death diagnosis as COVID who tested positive 60 days ago and had absolutely no symptoms. They simply died from a stroke, but they got classified as COVID because of it. I understand, it's been 6 months since the city declared their emergency. The communities, the businesses, the residents, everybody made efforts to help mitigate the risk of the spread of the virus. And we didn't want to overwhelm the healthcare system. We did our 2 weeks of stay at home like 6 months ago. It was only supposed to be 2 weeks, and we're 6 months later. At some point, this emergency order, not just the mask, but the emergency declaration the city made, and even the other governments, at some point these need to end, because you all made it clear tonight. Even the health director indicated that, well, we're going to this point that now the flu is going to get convoluted in all of this, and it's just going to continue. It's going to continue the rest of our lives, and those that live after us, this virus is going to mutate. We have to learn to live with it. And at some point, we are actually compromising our own individual rights. Our country was founded on basic human rights, including, as mentioned earlier, the pursuit of happiness. We have the freedom to decide, and we receive out of that the responsibility of the consequences of the actions that we take, and that falls on individuals and businesses. It's not the government. The government should only inform people, not protect people. That's their job. That's your duty. Just at this point, I'd stop harassing these businesses. If they don't want to wear a mask in the business, don't make these businesses wear masks. Don't make them make their customers wear masks. Yes.
I'm sorry, your time is up.
Thank you for the opportunity.
Thank you. Next speaker is Sarah Johnson.
Ms. Johnson has been admitted into the meeting.
Good evening, Ms. Johnson. Welcome to the council meeting. Please state your name and city, and you have 3 minutes.
Hi, my name is Sarah Johnson, and I'm a Kingman resident. Hello?
Hello, we can hear you.
Oh, okay. Hello, Mayor and Council. With the recent remainder of business openings, I don't know why we wouldn't want to keep the mask mandate still in place. After all, the data has shown that that is why the numbers have gone down in the entire state. So yes, open the businesses, but do it safely. Practice the steps to getting us back to normal safely. There are other cities who are doing this well. I visited both Phoenix and Payson recently, and they didn't have a problem doing this. Also, it has been recently revealed in taped interviews with Bob Woodward that President Trump had said back in February that this virus was far more deadly than even your strenuous flus, and that the reason it was played down was to not incite panic. But that playing down has cost about 200,000 American lives. and survivors are still left with effects from having COVID, and no one really knows the severity of those effects yet. Look, we've had warnings before. Let's not keep making the same mistakes. Let's learn from what happened in the super spreader event of Sturgis. Those folks were careless, they weren't wearing masks, and they weren't social distancing. And that one event led to 250,000 new cases. Do we really want to learn the hard way? We've seen what can happen. Let's do what we can to be part of the solution, not a bigger problem. And lastly, I have a question for Vice Mayor Lingenfelter. What is the mask policy at the Lingenfelter Center? I ask this because I've seen several social media posts and comments from Vice Mayor Lingenfelter saying that he has consulted with his doctor on coronavirus. So I'm just curious as to know what the policy at his family's business is, since they are also in the medical field. Thank you.
Thank you, Ms. Johnson.
Mayor Miles, do I get an opportunity to reply to that since I was addressed directly?
Let's ask Carl. Mr. Cooper?
Yes, ma'am. This is just, this isn't like a public hearing where the replies are restricted. You can either respond to this comment now, or
So Vice Mayor can respond to that?
Yeah, there's no problem. Or you can wait until you're done with all your speakers. It's up to you guys.
Go ahead, Vice Mayor.
Thank you, Mayor Miles. I'll just make it short and sweet. What I would say to the speaker is that at all of my family's facilities, which are congregate settings with vulnerable populations, they're obviously rightfully and logically locked down like every other congregate setting with vulnerable populations. That makes logical sense. Thank you.
Thank you, Vice Mayor. Our next speaker is Pamela Malouf.
Ms. Malouf has been admitted into the meeting.
Good evening, Ms. Malouf. Welcome to the council meeting. Please give your name and city, and you have 3 minutes to speak.
Mayor, she is still muted.
Yeah, I'm sure Annie's trying to work with her. Hello, Ms. Malouf.
Yes.
Welcome to the, hi, welcome to the council meeting. Please give us your name, city, and you have 3 minutes to speak.
Okay. This is Pamela Malouf. I'm from Kingman. I'd like to thank Mayor Miles and the council. And can you hear me, by the way?
We can hear you fine.
Okay, great. Thank you. I would like to thank Mayor Miles and the council for mandating face coverings in late when Arizona COVID deaths were skyrocketing. Arizona was the worst in the nation and the very first state that had to trigger crisis care. Now, thankfully, Arizona took action and implemented masks and social distancing mandates, including the counties of Gila, Maricopa, Navajo Nation, Pima, Santa Cruz, and more, plus additional cities or cities that expanded upon their county mask mandates, included Carefree, Flagstaff, Kingman, Mesa, Phoenix, Sedona, Scottsdale, Tempe, Tucson, Yuma, and several dozen more. In just 2 months, Arizona has erased our missteps, and we went from a high of nearly 200 deaths a day to around 5 deaths a day. And why? Because of masks. I think that's huge. Yes, any death is tragic, but evidence shows that masks do work in preventing the spread of COVID-19. They capture the virus-containing droplets we emit when we speak, cough, or sneeze. And most importantly, they work best when we all cooperate and wear them. 194,000 people in the United States are dead since February 28th, when President Trump accused Democrats of politicizing the coronavirus. And then he claimed that the outbreaks was the Democrats' new hoax. Well, now Trump admits on tape and in person to downplaying the virus. And our city council must not politicize or downplay the coronavirus. Members must stop pretending it's Democratic or Republican. An average of 32,000 have died every month. That's over 1,000 dying every day in America since Trump's February misstatement. It's enough already. It's not rocket science. And for the people complaining about their rights regarding a mask, they already don't have the right to go outside naked without being arrested. You can't yell or scream in a restaurant without getting kicked out. The road and freeway has speed limits we have to obey. You can't drive drunk in restaurants. You can't tint your car windows beyond certain limits. You can't just punch someone on the street. There's no shirts, no shoes means you're not dining in a restaurant. You have to be quiet in a library. You can't chew gum in a courtroom. I mean, so those who want to whine and complain about wearing a mask, I'd like to say, let's be smart, let's be considerate, let's respect scientific data. Someone you know may and love may be the next person to die. And this past 14 days, the COVID infection rate in Arizona has dropped 20%, and the death rate dropped 66%, which proves that mask wearing is slowing down the spread and the deaths. We can open everything, bowling alleys, gyms, and keep our businesses open while still keeping the virus deaths at reasonable levels until there is a vaccine, but only by continuing the mask mandate, at least through 2020. So I hope everyone will support the continued face covering requirement. Thank you.
Thank you, Ms. Malouf. Thank you. The next speaker is Jennifer Esposito.
Ms. Esposito has been entered into the meeting.
Ms. Esposito, please give us your name and city, and you have 3 minutes to speak.
Hello.
Hello. Hello, Ms. Esposito. Please give us your name, city, and you have 3 minutes to speak with the council.
Yes, this is Jennifer Esposito, writing candidate for District 4 County Supervisor, 3211 East Snavely Avenue, Kingman. As a point of order, I requested to speak at call to the public. However, since you have called me, I will speak to this item. We are absolutely not all in this together, and I do not need government to protect or manage my health risks, by the way. I'm exempt, so I need not comply. Correlation is not causation, and the science is anything but settled. So you can cherry pick whatever science suits your political agenda, but that does not make it factual. The purpose of government is to secure the blessings of liberty. It is not to protect the public health. And when you raised your right hand and took an oath to the Constitution, that's what you were taking an oath to do, to protect our liberty. It is absurd to punish Kingman businesses when the public is free to choose to abstain from patronizing these businesses, and they can choose to instead shop online or outside the arbitrary borders of the city limits. Therefore, no reasonable person would actually believe that enacting such a draconian mandate in such a small geographical area would have any benefit that outweighs the damage it would incur to the community. In closing, I'll make this brief. At 5 p.m. on Sunday, September 20th at Metcalf Park, there will be a funeral service for the political career of the mayor and any member of this council who votes in favor of ratifying this mask mandate, and recall petitions will be available for the public to sign. Please wear black and be respectful. Thank you. Goodbye.
Okay, the next speaker is Kate Bodley.
Dr. Bodley is no longer connected.
Oh, Kale, is it Kale Dr. Bodley, okay. No longer connected? Okay, Annie, could you please report on the written comments that we had on this subject that we received before 9 o'clock this morning?
I sure can. Give me just 1 second to grab that. Okay, we received for item 5A, 176 written comments. 113 of those were in support of the mask mandate, and 63 of those were in opposition of the mask mandate. Those comments were provided to council for review.
I missed the very last part of that. 113 approved for approving the mandate and how many opposed?
That's correct, 113 in support of the mandate and 63, sorry about that,
That's okay.
63 in opposition.
Okay, thank you very much, Annie. That was a lot of emails to get through. Appreciate it. Okay, so we have heard the presentations and comments, and now I would open this up to council for discussion or a motion.
Madam Mayor, if I may, I'd like to make a few comments.
Please go ahead, Councilor Waite.
Thank you. So it's no secret that this has been a very emotional topic for just about everyone. As you and my fellow council members are aware, we've received quite a bit of a response from the public. We've seen some very passionate arguments for both sides, for and against this proclamation, and we've seen some pretty unfair accusations levied with respect to this issue. And I think that the only way to forge ahead is by leaving emotion at the door and spearheading this using only facts and figures. And I appreciate the fact that we had some representatives from KRMC to come and speak with us and give us their expertise. And I certainly hope that we consider what they've said and recognize the fact that they are experts in their field. But we've received dozens of emails over the past several weeks. What was the number? 113 or 176 total from concerned residents. And I think the most aggravating aspects of this topic is how discourteous some people have been in trying to persuade people to toward their side. At the last council meeting, we witnessed some pretty despicable behavior, and it doesn't take a lawyer to point out that that hurling insults at someone doesn't generally make for a compelling argument, especially when the recipient of such an unfair assault is a good person and cares deeply for this community and the health and safety of the residents of Kingman, and is just trying to do what's best. So with that said, if it pleases the court, I would like to go through sort of a brief analysis of some of the arguments that I've heard and considered before making my own recommendation, because I believe that it is important to acknowledge good points and weed out the bad ones. And I think that, we can come to some understanding even regardless of what side you land on. And so I think what I'll do is I'll start with the most compelling arguments, because I think that most of us have a significant amount of common ground from which to work from. And so at that point, we'll work through the weaker ones and so that it's clear that the most conceivable arguments, even the bad ones, have been at least considered. So first of all, I think that it's incredible. I think it's good how people on both sides of this argument are deeply concerned with the preservation and the survival of the small businesses within our community. On the one hand, the theory is that a mask mandate keeps people from shopping local because many people refuse to wear masks, or they have a medical restriction, or they're otherwise uncomfortable and would prefer to simply shop from home because they don't want to be forced to wear a mask. And on the other hand, you have people who are concerned for the safety, for their own safety or for the safety of their family members, and would prefer to shop online knowing that there are many people out there who may be infected and are not wearing masks, and a mask mandate gives them the peace of mind that the majority of those shopping will be less of a risk to them. So I think we all have the same intention, yet we get there, in a different way. And so, personally, I'll admit that I have a child at home, and he is immunocompromised. He's at great risk. And every year that my little buddy gets the flu, it's a 3-day stay at KRMC while they administer breathing treatments, and they pump a bunch of steroids into his lungs, And it's just a terrible thing for a parent to have to watch. So, that's kind of where I come from. Whereas I used to peruse the store aisles, and purchase things not on the list that my wife gave me to go buy. Now I kind of just bolt in there, knowing that there could be infected people. I get the things that I need and I get out of there, as quickly as I can. But so I think that there's an argument to be made on both sides, and I think the ultimate thing is that we're all kind of on the same side. We want to see our economy thrive. We want to see our small businesses survive and excel. And so I guess that's kind of the objective of both sides. So another good argument that I saw sifting through all the emails and my own research online is that masks may have a tendency to convey a false sense of security. And to that argument, I would say that I don't think that anyone believes that masks repel the virus with 100% certainty, and that those with vulnerable family members probably ought to continue to take additional measures to ensure safety. And I think most people would agree with that. So going to some of the less compelling arguments, I think that one of the least compelling arguments that I've heard so far are the several threats from Kingman residents claiming that the council members will be removed from office or recalled, and that if we want to keep our jobs, that we will do what they say, and that a vote in favor of a mask mandate is bad for our political careers. And I have a problem with this argument. These warnings give the impression that they were meant to intimidate us or bully us into, yielding on the basis of self-preservation. And I would argue that any politician who's persuaded by such an argument and would make a decision on the basis of self-preservation rather than being guided by their research or their integrity is in politics for the wrong reasons. And that individual should be removed on that basis alone. So I don't think that intimidation is a very compelling argument, especially not for me. But our decisions should be made based off of a fair balance between what is best for our constituents and based off of all the available data that we have, coupled with the will of the people, not out of fear of keeping our position. I think that's just that would be a bad policy for a council member to have. So I'm not particularly persuaded by such an argument. On the same token, over-exaggerated language like mask enslavement, I've seen, state-sanctioned child abuse, illegal muzzling, those types of things are not particularly compelling, and I would argue have a tendency to cause a person to take an opposite position because they don't agree with the exaggerated premise. So, emotionally charged language may have the opposite effect. And when I read through some of these emails, I think I don't know how great of an argument that would be. So one of the other arguments that I just want to briefly talk about is the government's, I guess, involvement with respect to the public health and safety. And I would reject the argument that the government has no right or should not concern itself with protecting people's health. I would say that I might even go as far as to say that the opposite might be true, and that one of the responsibilities of the government is to protect the health and safety of its constituents. And that's not to say that the government needs to micromanage, every health and safety aspect of a person's life, but the government has a general interest and, a duty regarding health and safety. So I don't think it's outside of the government's authority to, impose regulations to keep people safe. A number of people cited blog posts and articles claiming that masks don't work, and I couldn't really tell if the proponents of this argument believe that masks have zero effect at reducing the risk of infection, or if they were simply emphasizing the argument that masks are not effective to the degree that the government should get involved. So in any event, this is a new virus. You know, we don't know a lot about it. We know very little, and we're learning more and more each week. You know, due to the fact that I am confident that I'm not smarter than a virologist or a scientist who studies viruses, I think that it might not be a bad idea to err on the side of caution when it comes to, or when virologists work with the CDC and have advised that masks help to slow the spread of COVID. So I don't believe that they are advocating that masks are 100% effective or that the government should force a mask mandate in all cases, regardless of the circumstances. I believe that it simply supports the argument that mask wearing can have a positive effect at preventing the spread of COVID in some circumstances. I've heard many people call this thing a hoax, and I don't know if they're referring to the virus itself or just the reporting numbers, which are, you know, obviously suspect. But I can tell you that my dad, who is the strongest person I know, he was in the hospital for 6 days on oxygen, and he was 1 day away from being placed on a ventilator before the plasma they injected into him from a recovered patient's antibodies changed the game for him. So it is a serious virus. It's not a hoax. It's a real thing. One of the very common arguments that I saw was the my body, my choice argument. And, you know, I've heard a surprising number of Republicans proclaim this slogan, and some of them don't even bother to mask the flawed principle by changing up the language. They literally use that language. And there are a number of regulations that serve a compelling governmental interest that regulate or govern what we can't do to our own bodies and what we consider personal freedoms. You know, as a prosecutor, I can attest to this. For example, you know, even if one only hurts oneself, you know, you may not, for example, you know, you can't consume illicit drugs, you know, illegal drugs, even in the confines of your own home, it's illegal. You can't exhibit lewd or lascivious behavior. You know, prostitution, even between consenting adults, is illegal. Suicide, assisted suicide, you know, is illegal. Seat belts are mandated. Car seats for children, you know, to protect them and their health and safety are mandatory. So I reject the premise that we can't, you know, that we can do whatever we want to our own bodies, you know, even if we feel that it only affects our bodies, you know. But to sort of morph this conversation towards, you know, another common argument that was made regarding our constitutional rights, you know, when it comes to compromising the health and safety of other human beings, we don't have full authority to do whatever we want to our bodies. And it's the same argument that we as Republicans would make toward anyone who says my body, my choice. You know, we don't have authority to do things when it has an effect on the health and safety of another person. So I guess the question is not whether we can do whatever we want to our own bodies, because obviously the government has an interest. We've conceded that authority on many of the issues that I just, you know, listed, and the others people have listed as well. But the question then becomes, you know, where do we draw the line, and to what degree do we want the government to regulate our actions? And I think if I were to make, you know, go to the extreme, that I think that most people would agree that if the coronavirus death rate was at 99%, for example, which obviously it is not, we wouldn't have a problem if the government imposed a mask mandate in that scenario. And the counterpoint would be that if a mask mandate, that I think most people would reject a mask mandate if the death rate were at 0.000001, you know, or even anywhere below the death rate of the regular flu. So again, the question is, where do we draw the line? And when does it become acceptable to allow the government to step in? So, you know, we're in a global pandemic right now, which is obviously different than the flu. And I think what we need to consider is where that line is to be drawn and, what would be acceptable. So I want to talk about the proclamation just really briefly. I apologize, and I know I've gone on quite a while, but just briefly, there are some things about the proclamation that I very much appreciate. I found that the proclamation is appropriately and narrowly tailored to serve a compelling governmental interest, and I appreciate the fact that it has a variety of exceptions to the mask requirement, including small groups of people, with whom one is closely or frequently associated. It covers those people. It wouldn't apply to situations where 6-foot social distancing can be maintained. People with health conditions, children under the age of 6, people engaged in a religious ceremony or a service, individuals who are eating, people who are outdoors. And then there's the catch-all: when wearing a mask is not feasible or practicable, etc. So there are a variety of exceptions to the mandate or to the proclamation, which I think are very good, and I like those. My main concern with the proclamation is that the goal is not specific. And I understand that we want to curb the spread of COVID to protect the health and safety of the residents of Kingman, but to what end? And I think people want to know, where the line is to be drawn. So a lot of people, including myself, are reluctant to get on board with a proclamation if we are not told what the end game is. So, questions like, will the council repeal the mask mandate only after a complete eradication of the coronavirus? Is that the end goal, that coronavirus is wiped off the face of the earth and we're okay? Will the proclamation be repealed upon release of a vaccine? Will the proclamation be repealed if the infection rates in Kingman drop below a specific level and stay at that level for a specific number of days or weeks? Or if the death rate drops to a specific number for a specific amount of time? Previous face mask proclamation timelines have come and gone, and we don't really know what specifically will trigger the light at the end of the tunnel. So if we leave the proclamation as is and we get to the end of December, how do we decide if we're going to extend the proclamation beyond December or let it expire at that time? So what I would be looking for is some kind of objective criteria and not necessarily a gut feeling. I think Regina Cobb made a comment about that. I think the term she used was arbitrary, was the word arbitrary. And so, it's not, it's understandable that people would want to know if we plan on piggybacking off of trends or seeing other cities start to repeal their mask mandates, or what is the objective criteria that ties the proclamation together. Like, would the council consider infection or death rates below what is considered pandemic levels, perhaps levels that are similar to those accompanying the common flu, or what is the end game? So there's just a lot of questions out there. And, I would like to see, if I'm going to be on board with, a mask proclamation, I would like to see us, bind that proclamation to some objective criteria, especially a proclamation whose end date is so far out into the future. I've heard the term, and Regina Cobb mentioned this term, the new normal. And like many people, I absolutely despise that phrase, especially as it relates to all things COVID, because, under no circumstances do I think that people or politicians should become complacent when it comes to curtailing people's liberty. And I think that we need to continually have this at the forefront of our mind. So if the government is going to impose upon people in this manner, then this is a subject that should be frequently addressed and reevaluated. As laborsome as that might be, but I think that's something we need to do in the name of restoring liberties. So currently the mandate obviously is at the end of December. What I would like to see is us, reassessing this on a more consistent basis, because things are changing. The virus is new. We keep getting new information. So that's one thing that I'm looking for. Just for a comparison, and as cold as this may sound, I think that the U.S. is in general has conceded that as it pertains to the flu, for example, there's an acceptable number of deaths per year that are not substantial enough to force people to wear masks all year round for every year for the rest of our lives. At some point, a line was drawn in the sand to say, we're not going to make you wear masks if this many people, have died or get infected. So I think in 2019, the number of people who have died of the flu virus was around 34,000 or something, and there were over 35 million infections. At a certain point, a line was drawn in the sand with respect to the risk that we're willing to take compared to the negative consequences of mandatory mask wearing. So, there are numbers out there, and I think we can reach those, or at least look at those. And I understand the argument from a lot of people who are not particularly fond of the proclamation due to the, what appears to be inaccuracies in the COVID reporting with respect to like death rates and those things. I understand that many people are of the opinion that this proclamation has made great strides toward tamping down the spread of COVID. And I certainly, I don't disagree, nor would I want to be responsible for undoing any progress that we've made towards controlling the virus. But I would like to see some objective criteria in the proclamation, and I would like the council to consider a more frequent reassessment. I'm sure there are those on council who support the current proclamation as is and are prepared to vote in favor of it today. But if it doesn't pass, I would be more than willing to entertain the option of temporarily ratifying the mask proclamation until the next city council meeting, wherein we can discuss some parameters, or objective and acceptable criteria that we can use as a benchmark to trigger the end of the proclamation, so that there's a light at the end of the tunnel. Because people are just, one of the things that people are upset about is it's way out there, and what is going to change our minds from today compared to December. And I'd like to maybe at least discuss it. So I think it's important to let the residents know that there's a plan in place, and that any mandates imposed are objective and not based on a gut feeling. We may consider benchmarks such as if the city or county maintains a low, predetermined and acceptable or reasonable infection rate or death toll, and the numbers stay within a certain range for a predetermined amount of time, we can lift the proclamation at that time, or at least go back to discussing it. We may even tie the mandate to something like the discovery or distribution of a vaccine. I don't know, but we have options, and ultimately I'd like to see some objective criteria that we can work into the proclamation so that we can give people some kind of something to look forward to, or at least something to rely upon. So I think that's all I have to say at this time. Thanks.
Councilor Waite, is that all you have to say? Are you done?
For now. Sure. For now, I think I'm good.
Okay. Oh, well, that was a lot of information and a lot of analysis, so thank you. I heard a lot, but going back to your point just briefly on the parameters. One, that is not a new subject. The fact is, that's one of the reasons we'll be having other treatable and preventive measures before long, in a few months. But as the doctors did too. I had that discussion just talking to Denise Burley, getting this agenda together. I said, how does it end, you know? And so I understand the question. And both of us discussed the vaccine. That's a very important breakthrough moment when we have that, because then you have a different way to protect each other. But the other thing we discussed, well, one thing I mentioned was when we no longer, the state of Arizona is no longer in an emergency state. That's another good clue. And then with respect to your point about benchmark measures, getting to a certain level and staying there, I've had that discussion also, and we could have that as a council, but it's very, again, you get into, just as the physicians were saying, the fact is we've brought those benchmark levels down. When we're in a business moderate zone, we need to get it down to a business minimal zone. We've discussed things like that, but I don't think there is a concrete, other than vaccine and no state of emergencies declared, that has been defined. The benchmarks, if we get them down to minimal, do we want to keep it there for a certain period of time? That's certainly worthy of a discussion. But again, I look at this, I look at a period of time that I equate, maybe it's my past life as educator and all this, to a semester, where you, because we have so many things happening dynamically for the next few months, that we don't want to take the risk to change the success, as I called it, don't test the success yet. I think it's very good discussion to have on how do you end. I am having that discussion with many, and I think the council could have that too. But to tie it into the proclamation, I think right now would be a little difficult, only because I know it's not an easy discussion to come to a conclusion on. And because there's nothing arbitrary about all of the mass proclamations that have been made in this country, the state, or the city. That kind of is an amazing term to me, because when the three mayors, Bullhead, Havasu, and Kingman, decided that this is really needed, we were basing it on all kinds of data that we were watching every single week, and still are watching with the health department and with our hospitals. So it's not, these decisions for protection are not arbitrary. I just want everyone to be aware of that. The end game, the discussion about the end game, I think has validity. And I too am asking the question of many. And again, as I say right now, the best I've gotten are tied to some benchmark that stays the same for a period of time, or a vaccine, which I know is a good end game once it's really distributed. But I would be open to that discussion, but I don't think we're ready to tie it into a proclamation, the body of a proclamation. That's my opinion. There are lots of these that have been issued. I don't know that anyone has inserted other than saying we'll reevaluate this at a certain time. I think that's the strategy most municipalities and states are taking, to reevaluate based on, you know, what's real at a certain time. And I don't know that anybody's already picked out their endpoint or their end game in their proclamations. I could be wrong. I haven't researched that broadly. I just know what's happening more locally. So that's my thoughts on that. I just did want to say, I just want to reinforce there's nothing arbitrary about issuing these proclamations. If it were, so many people throughout this country would not be doing it, and mayors and governors. It is, and is working. So I'm open to the end game, and I'm open to the council having other comments on this issue.
Mayor, may I?
Yes, Councilor Nelson.
Thank you. First, I need to congratulate and just, Mr. Waite, Councilman Waite, you showed your passion, you showed your love, you showed some true colors tonight, and frankly, kind of proud of you. Good job. Good job. I'm going to be a dissenting voice, and I'm going to be a dissenting voice for a very specific reason. I cannot, in good conscience, tell people seriously what they need to be doing and where they need to be, and how they should choose to live their life and where they stand. Most people know me. Most people understand that's where I come from and how I approach things. There is no political backing on that. There is no. I could care less about what your role in life is politically. I'm angry. I'm angry at the fact that people have chosen to be nasty, mean, nasty over a damn mask. If you don't want to wear it, why do you have to pick on somebody that does? And if you are going to wear it, why do you have to pick on somebody that isn't? At what point in time did we go from hating bullies in this world to becoming bullies in this world? And a stupid face covering has brought that out. That's terrible. That's sad. That's embarrassing. That's heartbreaking. That's everything. At what point in time do we look at each other and just simply say, wow, I appreciate your thoughts. I appreciate that you have a thought. I appreciate that you made a decision. One way or the other, I don't care what it is. Why are we not supporting each other? Why are we not being kind to each other? What happened to kindness? And it's gone. It's absolutely gone. You're going to bump into somebody in the grocery store and they're going to tell you what they think about you. Why? That's evil. That's mean. That's nasty. Stop it. I want to look at you and say, I'm not going to vote for this tonight. And the reason I'm going to not vote for it is because I believe in personal responsibility and personal choice. That's my stance. Now, here's why I say that. It's simply because we're adults. We're grown humans. And God gave us a damn brain. Use it. Okay? So let's start there. But now on the other side of it, what happened to just being kind to people? Why can't you just look at somebody and say, I appreciate your thought process. It's not in agreement with me, but it's okay. That's fine. And frankly, that's really all I've got to say right now, because I'm just stupid frustrated with our world today. Stupid frustrated. I appreciate every single thing that everybody has said today, both scientifically, both emotionally, sometimes physically. There's nothing wrong with any of that. We're in America. Do you know there are other countries that you might actually not be able to voice your opinion like you can here? It's okay. Let's get back to just being kind to each other. Let's do that. And that's all I have to say. Thank you.
Counselor.
Mayor Miles, can I talk?
Please go ahead.
I appreciate Councilman Waite's comments and Councilwoman Nelson's. Both had some great thoughts and ideas there. I just would like to propose maybe the first council meeting of each month, so October 6th would be our next one. Maybe we get the numbers from Director Burley, kind of see how they are, and we can make a decision. I know that's a lot to ask, but so it'd be basically every 30 days we'd be having to make a decision if we want to continue the masks. That's another option, just throwing out there.
Thank you, Counselor. I can tell you, when I extended it for several months for cause, I thought this is like pulling the Band-Aid off all at once, rather than inching it little by little, because I realized it will take that long to get to really know the impact of some of the other things that will happen during the fall, and also to get the vaccine in place. But the Band-Aid is off, obviously, and has had quite the reaction. I think because I have had now 2.5 months of really the intensity of, and especially the last weeks, but throughout the whole thing of the emotion that's out there. There is a lot of emotion, but I do think that tonight we heard a lot from people who have not been having their voice, because they know that we're going to make a decision. And I have always thought, based on my discussions with the education community, the healthcare community, even the judicial community I've heard from, that we need time to continue the good of this mandate. And so I did take that step and extended it, knowing that it would be unpopular, but knowing that going through this every month is also, I haven't seen any let up in people feeling like, oh, now I get a chance to, now I'll get a chance to talk again or send my thoughts again. They'll keep coming, but if I go back to Councillor Waite's point, I can see the discussion about the end game, what is the criteria for ending the mandate, and is it really just pushback? Is that really the criteria? That's what the hope is by some, but I don't think that's the right one, and I haven't heard anybody suggest that. Quite the opposite. So I'm open to that discussion. If the council wants more frequent review and discussion on an end game, I am open to that. I think having it again in 2 weeks is premature, because there's the agitation continues for people who are people who do not like it, and then the people who really want it have to stay engaged too. And so do we want the community engagement to have to be that frequent? And maybe we do, but I think we've heard from a lot of people now. I think we've heard from a lot of people in our community. We've heard from our healthcare professionals. We've heard from our health department. We've heard from other politicians. The only thing that I think we don't know, which has not been defined by anyone that I'm aware of, is what's the right moment to just stop this and repeal your own mandate. And there is a moment, and as I said, it's not, I don't think it's that far off because of the progress. I mean, this is unparalleled in the history of the world, how much science has moved us forward. But until we have a safe environment without protective measures like face coverings, I think it's wise to keep them. But I'm open to that discussion. I just think that monthly, if it is monthly, I would start. I would for like 6 weeks or something like that. Or if the end of the year is too long, maybe split the difference and what is it? The end of October or the beginning of November. Give time for school to start. Give time. I know that we've had some cases in the schools. Give time for flu season to hit us and see if that's going to impact. We really need to keep this in place, my opinion. And I would be be open, though, to agendizing a discussion of how do you know when it's time to repeal it?
Madam Mayor, this is
Yes,
Vice
sir.
Mayor Lingenfelter. May I make a few comments?
Of course.
Thank you. Well, first off, I want to say thank you to Councilor Waite and also to Councilor Nelson. I think both of our councilors have hit the nail right on the head. There's been a tremendous amount of emotion on this issue, and from that, some really ugly vitriol on both sides of this issue I've seen. And I agree, it hasn't swayed councilors, and it's completely unnecessary. There's a lot of different perspectives represented on council, but I want to say that every single councilor that we have has a heart for Kingman, Arizona, and we all want to see Kingman thrive and do well, and make it through the rest of 2020 and into 2021. So I'm thankful to serve with all of you during this tough time. It's a challenge. Something else I'd like to say is, as evidenced by the backup documentation that we were all provided, I think it's important to say that there's a number of private businesses that have enacted policies of their own that will still remain in effect no matter what a majority of this council decides to do. That look like a very sizable list of private businesses that have taken it upon themselves to institute private mask policies. And the citizens that actually live in city limits, or, I think there's another 30,000 people in the surrounding communities that shop in Kingman on a weekly basis. And I know that there's another 28,000 that go through on I-40 every single day. They have a choice whether or not they want to shop there or not. So I also appreciate all that have reached out to our council, either for or against this issue. And I'm sure all of you, like me, wish that there was this much public participation on all city business items. It's been almost overwhelming. So I want to thank everybody on all sides of this for your involvement in making city policy. Based on the data that I have seen, like everybody else, I've been looking at the data from Mojave County Public Health Department, the national data from CDC, the data from the state on reopening. Based on the data that I've seen nationally, there's about 3% of the US population that has tested positive. 97% have recovered or are in the process of recovering. The last numbers I've seen, there's been a reported 3% mortality rate out of the 3% of the US population that have tested positive. And when you come locally to home in Kingman, per the Mojave County Public Health data that was just presented, and I made sure to confirm this, we have had, for the entirety of this since March, 491 cases in Kingman. When you look at our census population, 31,000 people, it's about 1.6% of Kingman's population that have tested positive. 437 of those people have either recovered or are recovering. And we've seen 54 deaths. And we know that, as has been the case nationally, that a majority of our losses locally have occurred in our vulnerable populations in congregate settings. And that was very sad that we've seen that happen. And I think, as it's been talked about a couple of times tonight, that those extremely vulnerable populations should continue to remain locked down and take the most stringent precautions, because they're obviously the ones that are the most at risk from this. For the majority of Kingman's population, it's my own view that if a public agency is going to establish a mandate that affects everyone's life, then, as it's been stated before, it must be well defined. It has to be narrowly tailored as possible. and as temporary as possible, and also tied to clearly stated and logical criteria. All of these precautionary measures and shutting down our private businesses started in March with the stated goal of 2 weeks to flatten the curve. We were all familiar with that term, in order to prevent our hospital from becoming overwhelmed. That was the central purpose of all of this stuff. And this made sense back in March and April, when the disease models that we were seeing and that were being reported on were predicting 2 million deaths in the United States alone. That was very scary. In actuality, it's still tragic, obviously, but I think the US is at around 197 or 199,000 deaths, which it's still sad, but the models have just not hit the mark at all. And 7 months later, we still have partially closed Kingman businesses, and the response seems to have shifted from preventing our hospital from becoming overwhelmed and running out of supplies to a term that I've heard called a case-demic, with no criteria for a return to normal. Just increased testing to I guess get the percentage of positives down. But if the hope is that vaccines will eliminate COVID-19 and then we can return to normalcy, I believe that is, in my opinion, a flawed conclusion. I think COVID-19 is here to stay. We're not going to eliminate COVID. If you look at the CDC influenza data for 2018, 2019, past years, you'll still see that swine flu, H1N1, which was another coronavirus, it's still around. And now it's just listed as one of the many flu strains that's out there. So to put all of our hope on a vaccine, which, we have vaccine for a number of strains of influenza and we still have flu cases. So that's confusing to me. So I guess it does bring up the question, at what point is it recommended that we remove the mandatory masks? If it's until there's a vaccine, then I don't believe that represents, in my own opinion, a balanced public policy to deal with really the three concurrent crises that we're dealing with. There's a public health crisis, there's an economic crisis, and there's a social crisis. And I think that it's some of the public health officials that we've heard from, it's their job to focus solely on the public health crisis. But as elected representatives of everybody, we don't have that luxury. We have to take a more holistic and balanced approach on all three of those crises. And I think it's impossible, really, to 100% risk-proof life. You just can't do it. And for that reason, and because I really haven't seen any clear criteria for returning to normalcy, I believe that masks should really be voluntary and should be a health decision that is made by individuals and their families with their primary care physician. That's something that we all need to do. That's a relationship that we all need to have. And that's who we pay to give us and our families our health advice. As I said before, stores can still, and they can still implement private store policies on face masks. And our citizens and people that are from outside of Kingman that come here to shop can maintain the freedom to choose which businesses they patronize. Or there's so many other options where they can order things online and continue to shelter at home. So I think when you look at how many people that we have in Kingman in city limits, you look at the additional 30,000 people that come here to shop, you look at the 28,000 people that are on I-40 every single day. Overall, through this whole pandemic, Kingman, when you just look at Kingman data, we've done pretty well. And I think it's because people here, we take it seriously, individually, and I think we'll continue to do what's right after consulting with our doctors. I really do. I believe that. I think that if you put all the hope on a vaccine, that's really kind of wishy-washy, and nobody knows if it's going to work. It's been fast-tracked. I've heard by the end of the year, but really I think that's pretty optimistic from other things I've read. And I don't think that there's support their support for keeping people mandated and masked up for another year. And I know it seems unreasonable to say that, but without any real valid and concrete criteria, it's absolutely a possibility like everything else. So for that reason tonight, I'm going to vote that we make masks voluntary, excuse me. Thank you.
Thank you, Vice Mayor. Okay, I'll mention a few things. One, I don't think anybody's pinning all their hopes on vaccines, and we certainly don't expect COVID to be eradicated. But when you cite the numbers that were cited tonight for flu, and I think it was Councilor Waite said that there were 30-something thousand in 2019. Well, we've had almost 200,000 COVID deaths in 5 months or so. So I think their order of magnitude's different. I also think the nature of the virus is different. And I'm hanging my thoughts there on what was exactly said tonight by the doctors that were here from KRMC, plus a lot of other things. This is not just another flu. And if it were, I don't think there would be massive investment by our country and all over the world to find this vaccine to stop it. It is impacting lives in countries that aren't as fortunate as ours to have the health care we have. It is truly being an epidemic disaster. But we've had a taste of it, and I think it is our responsibility to make sure that we don't have another surge in this area or in the state. And when it comes to business, I have said, and I truly believe it, and if you look at the business benchmarks that our businesses are operating with, as this case number and this positivity rate has come down, they have been able to reopen. And if I believe the doctors, they said countries, they have lower mortalities. That's where we are now. We have come down to have lower case numbers and lower mortalities. And by the way, I think our mortality rate for our area is still much higher than the state or national average. But be it as it may, we have been successful in helping our businesses reopen. And we also know that those business benchmarks, which are right still on the margin as far as I know, in terms of going into a moderate zone, 2 weeks of a positivity rate that goes back up over 10, they're going to close them down again. And I'm not talking about us, the city. It's never been the city. It's never been me. We are operating as under state executive orders. And so that's a risk to our businesses. And that's a risk that I don't know even if they understand that if our area starts spiking up, they are at risk of closing down again. And I don't want that to happen. The other piece of this is, and we could go back and forth and I won't, I'll just say, I totally think that just deciding what I'm going to do it isn't enough. I need to rely on everybody around me. We are all doing the right thing. And to protect each other, unless you just have an exemption. And as Councilor Waite said, there are a lot of them in the proclamation. I've had small businesses, and when this all started, and before issuing the first proclamation, one of our local owners of several significant gasoline stations, which have a lot of people coming in and out of Kingman, contacted me very angry because he wanted a mask mandate for, he said, his employees' protection. He said, we're doing it, but we want other people to do it. And he wanted it. Now I have other small businesses in this town, and they're often the mom and pops, because as you said, anybody with corporate policies has already figured this out and made the policies. So there's a long list in this community. Most of the franchises, most of the corporate, anybody with a corporate policy, just about, they've required this. But it's all our small mom and pops that say to me, or at least a number. I know there's some that don't agree, but they say, you know, we don't want to be the bad guys. We don't want to be the bad guys for our customers and say, we're requiring you to have a mask because I'm compromised. I'm the owner, but I have compromised. I want my people coming in. And yet the city having a consistent policy that aligns with the schools, the healthcare facilities, any corporate policy, we give a consistent message to this community. You don't have to guess where you can shop. You don't have to guess which business you can go in. Just put on a face covering, unless you're exempt. And there are a lot of exemptions, but going to the point of not being kind, I have not, I go to the store quite a bit, and I haven't really seen, I haven't really seen that. People that I've seen have been respectful, but I've certainly gotten emails about it. And it is sad, and it is true that it happens, obviously. But that goes back to, I think, as Councilor Nelson was saying, individual behavior and individual responsibility. We can't stop everybody from being unkind. And if I could, believe me, I would have stopped a whole lot of it that has happened in the last few months, but politically. But in terms of human behavior, we can't stop all of that. We can only do the right thing. And the right thing to me is to know that this isn't a political issue, to recognize that, to acknowledge it. To me, it is so clear, and it always has been clear, that this is a health and safety issue. And I have all the experts, and not just the local ones, the state, federal. This helps. This helps. Wearing masks will help keep your numbers down. And I have every reason to believe that, looking at all the data. So I'm going to vote to continue the proclamation. I would certainly be willing, as I said, and glad to participate in discussions on how do you know when you repeal it or when it's over. Because I haven't found that answer. I haven't found anyone who has quantified that and put it in writing, including our state, including our health department, but we've just had discussions on, obviously, when we know that pandemics end. I just read, I'm going to sidetrack a little, but I just read the National Geographic magazine on ending pandemics, and it covered all the pandemics historically. And we're talking about even things like smallpox and AIDS and many things. But, and then they would give a timeline, and they would show some of them had a longer one, like several years, some of them are short, but they end. The pandemic part ends. That doesn't mean the disease always ends, but the urgency of protection, such as we are in, diminishes. And so, and it diminishes because treatments are made and vaccines are made, and the numbers that we're experiencing now continue to be kind of the numbers that are, what is it called, a contained virus. It's not an eradicated virus, it's a contained virus. Right now, the best way I know, based on what I hear from medical experts, to keep this virus contained is to do these simple things. Wear a mask, socially distance, don't gather large groups, wash your hands. It's the governor, the health department's been saying that, the governor's been saying it for months and months. But I'll also tell you this, with all good intentions, we watched this after the state was locked down, and then the governor lifted it. And we ask everybody, and he asked, and we ask, and everybody asked, please do the right things. Wear a mask, wash your hands. You saw the surge go up until the proclamations, and then people paid attention, and there was an impact, and people did collaborate and cooperate with it, and the numbers went down. That's my experience, and that's what I continue to think will be the appropriate thing for us to do. And I'm going to have to take a drink of water. Anybody else want to talk?
Mayor,
Sorry. Please, Councilor Watkins.
give you a break.
Thank you.
First, I appreciate all the comments that have been said tonight. Well, and also all the emails, everything, all the call-ins, you know, look at the great passion that this issue has raised and the participation in government. We have to be thankful for our citizens for taking that right to say something. And we're blessed that we live in a country where we can do that. I was, you know, I'm one of the older, obviously, council members. I was born in '56. You know, back then, seat belts were almost not existent in cars. And during my teenage years, seat belts became more popular, and then slowly after that, they were mandated. I'm sure there was just, I don't remember it, but I'm sure there was just as much clamoring about nationally about having to wear a seatbelt. Nowadays, do any of us ever question wearing a seatbelt? Do it, because it saves lives. As far as the masks are concerned, another thing, an important metric. Government of Israel today, it was on Fox News, it pointed out that they are closing down their country. They're locking down their country again. Why? They're having another surge of coronavirus. Likewise, yesterday I heard on the news, France is considering a lockdown because they are having another surge of coronavirus. Do I like wearing a mask? No, I don't. I'm the first to admit it. But I do it because I am in support of the proclamation that is currently in effect. I do it. I think it's a humanity thing. I do it to respect others, because there are others in our society who are sensitive and they are worried about dying because they come in contact with COVID. So I wear it. As far as my fellow council members, my hat's off to all of you. Some great, great comments, and I appreciate all the time and thought put into it. The mayor mentioned, you know, continuing this until the state of emergency is lifted from the state. That might be a good guideline. Travis mentioned, besides the metric of cases, the health side of it, that we also consider the social side, the social dynamic, and also the economical dynamic when we decide how long we should extend this, when we come back to this. And then we throw in the whole quotient of the schools. You know, what kind of effect is that going to have on our numbers? I like what the mayor said and what David said. I think we should bring this back to the table the first council meeting in November. That gives us 6 weeks to re-examine the metrics, see what's going to happen, and considering, like Travis said, considering all the metrics, these other factors that come into play because of the effect it does have on the citizens of our great city. So, and most importantly, when it comes down to it, I'd rather err on the side of caution. One more death, COVID death, is really, it boils down to it's unacceptable if we could have helped stop it. So it's going to happen. We know that. David was pointing out there's with flu, there was an acceptable amount of deaths every year that happen, but maybe we can do our part to bring that number down. I would imagine this year, I have a feeling because of this COVID thing, more people are wearing masks. I bet flu deaths will be down this year too.
I do too.
So anyway, I would like to bring this I would like to continue the mandate, but bring it back to the council on November 6th, I think, is our first, or November 3rd is our first meeting.
Is that a motion, Counselor?
Yes, that's a motion.
Madam Mayor, I would second that motion.
Okay. So let me make sure. So the motion is to continue the mandate, but bring it back to council in the first meeting in November to reevaluate.
Yes, that gives us about 6 weeks, I think, that you mentioned. Um, let's see what happens because the effect of schools going back into session now, and our kids are going to school. Let's see what effect that has on our local society.
Yes. Thank you, sir. Okay, we have a motion and a second to continue with the mask mandate and have it brought back to council in the first meeting in November to reevaluate. Is there any discussion?
If I may, Madam Mayor. So I don't mean to sidetrack too much, but I did want to sort of poke at, or at least ask why. I think the recommendation was based on a comment made by the mayor referencing how long it might take to consider certain things. But is there any justification as to why 6 months will be required? Is there any way we can do it any sooner? I mean, I feel like one of the things that I would like to see is, a more frequent, reanalysis of this thing. As I stated, there are.
Counselor, wait. I'm sorry to interrupt. Did you say 6 months or 6 weeks?
If I said 6 months, then I meant 6 weeks.
Okay.
October. So essentially, I was kind of hoping that we would have some kind of temporary ratification of the mask proclamation until we had enough time to get together as a council and discuss the parameters or the objective criteria that we would base, an extension upon. And I don't know that we need to wait a full 6 weeks. I imagine we might be able to do that sooner. One of the arguments that I was making was that, I think the length of the proclamation is of concern to a lot of people, especially in light of the fact that this flu virus is obviously new, and we're learning a bunch of new things all the time about it. So, I'd like to keep it at the forefront of our minds, and even if, we meet in 2 weeks or whenever the next council meeting is, and we need more time to discuss or, analyze the situation, and we can extend it, a little bit further just to give us time to figure out, what benchmarks we could consider, what parameters we would use. But like I said, I want this to be at the forefront of our mind. So if Council Member Watkins could modify it, and make it possibly quicker or more frequently, so that we can have it at the forefront of our minds, so that we don't become complacent with this new normal that we all hate so much, and that we can, just readdress it and make sure that, time doesn't pass by where we're just, ignoring the fact that we are, imposing upon the residents a mandate that a lot of people don't like to do. So what I'm basically saying is that if I would certainly be on board if Council Member Watkins were to modify it and make it, something sooner. And again, if it is sooner and we're not prepared, we can always, give ourselves a little bit more time.
Madam Mayor, if I can continue.
Go ahead, Councilor Watkins.
I appreciate those comments, Councilman Wade. I'm not sure 2 weeks is long enough because of the fact that just the incubation period alone and exposure rate is 2 weeks. And so especially with schools going back into session. So the minimum, I think, would be a month, and the last meeting in October, or the second meeting in October. That's 30 days. Maybe we might have some numbers being generated by then. And if our downward trend continues, and as you mentioned, David Waite, that we need to set a benchmark. We need to put some numbers together where, okay, after we hit this number, maybe we can lessen the proclamation. I don't know.
I certainly think that a month would be much more acceptable. If you don't mind modifying
I
it.
have a question, Counselor Waite. Okay.
Sure.
Are you through? I've got a little lag going here. I do appreciate your intention. First of all, though, I don't hate the mandate. I don't, obviously. I think it's saving lives, and I think it's a small price that we're a sacrifice
I agree.
in the sense that we're all making against an invisible enemy to protect each other. And people going into other wars have to do much, much worse than this. And so I don't hate it. I think we're fortunate that something so accomplishable can be effective against this virus. And I am thankful for that. Some people don't agree with it, and just a minute, Counsel. And I totally understand that. I respect that. I just feel very much like I don't hate it. I hate the virus. I hate that we're in this situation, but I don't hate doing what I think is right to help us get through it as safely as we can. That's number one. Number two, when we bring this back and say, here's some benchmarks that we think are relevant to be an end game, I just want to say that I really I think we know what the options may be, and I'm kind of wondering which of us feels like we really can assess those benchmarks. Is it a minimal state for 3 weeks? I know how hard this has been for the state to come up with guidelines on this. So I just say that's a challenge. I think it will take some time and effort to come to the table in a meaningful way. And anyway, that's my comments, but I'm willing, of course, to discuss this, as I said. Councillor Staley, did you want to say something? Was that Councillor Staley?
Yes, thank you.
I'm sorry.
That's it. Thank you. I've been listening so carefully that I really didn't get a chance to put in my 2 cents yet. And so I'll be very brief because I think we've covered everything. Really great conversation tonight. And I knew it would be because when you take 7 people of different backgrounds and have them really assess the situation, I knew we would have a great conversation. And I really appreciate David Waite's argument. I'm really going to miss having you on the council, David. It was very helpful. And as well, Councilwoman Nelson's comments about human decency. It was a really important point to make that we need to get back to that. For me, I just want to say that I personally just cannot vote against something that I know will save lives. And I agree that, one lost life of a Kingman resident, just one person dying is too much for me. I think that's tragic. And when we talk about our numbers being in the 50s, it's too high. So for me personally, I'm going to support something that saves lives. But I also like Councilman Waite's comments about having an end game, because I think that is important. And I personally would support tying this to either the national state of emergency that President Trump has proclaimed, or the state of emergency that Governor Ducey proclaimed, as well as accessibility locally to a vaccine that would allow people who are most vulnerable to be able to protect themselves in other ways. That's all I wanted to say. Thank you.
Thank you, Councillor. Councillor Nelson.
Thank you, Mayor. I really think that we need to look at this a little bit sooner than November. I appreciate that we have the people who are saying don't stop wearing the masks, but there are just as many people out there And truthfully, I realize that our numbers today are looking at 60-40, 70-30, but what I'm hearing honestly is a larger group of people out there who don't want to wear those masks. And that means that my demographic is a little different than your demographic. And that means that my world is a little different than your world. And that's what that means. So I would like us to actually narrow that down to a shorter amount of time. There are those people out there that simply don't want to move forward with those. So let's give them a little bit of go, a little bit of leeway there. I'm a personal responsibility kind of person. If you're going to wear them, you're going to wear them. And if you're not going to wear them, you're not going to wear them. But I honestly, truly look at the world and say, be a stronger, better person and quit demanding that we tell you to do things. Now, I also am a mom of 2 children and 2 grandchildren, and I tend to look at both of them, all 4 of them, and say, grow up and handle things on your own. Now, good, bad, or indifferent, that's a whole nother story that we have. The point of it is, I don't like the end of the year mandate. And that isn't necessarily a negative against the mayor or against what's happening in our world. It's that this is changing daily. My preparation for this meeting today was, I had a scientific reason here and a scientific reason for and a scientific reason against. Within 2 weeks, I had completely opposite. And by the time today's meeting showed up, I'm now here again. Things are changing that fast. Let's not make it an end of the year mandate. Let's not. Let's bring that back a little bit. That would be my request. Thank you.
Okay. Well, thank you. I think everybody has had an opportunity. I think we still have a motion from Councillor Watkins on the table. And so I would ask Councillor Watkins, is that motion still on the table?
You know, I have no problem compromising, and let's bring it forward in a month, because once again, the proclamation will be in effect. And in a month's time, if we discuss it, we can either continue it or we can lessen it. So I think in 30 days would be fine too. I have no problem with that. So I would modify my motion that we bring it back to the council, the second meeting in October to discuss.
Which would be October 20th, I believe.
Okay, thank you.
Agreed.
And I will second that new motion.
Okay, we have an amended motion on the floor to continue the mask mandate until the second meeting in October, at which time it will be brought back to be reevaluated.
Madam Mayor, Vice Mayor Lingenfelter, I would.
And so is there any further discussion? Yep, no, Vice Mayor?
Thank you, Madam Mayor. I appreciate Councilor for amending his motion. You know, when I look at the benchmarks that we're at right now, we have an extremely low R0, one of the lowest in the country. When you look at the CDC criteria for reopening, I think they require like 4 weeks of a downward trend. In Kingman, according to our data, we've had maybe 5 or 6 weeks of a downward trend. They also talk about additional capacity in our emergency setting in the hospital, ability to have capacity for people that are sick, capacity to test, ability to test. Those are the types of things that I think we need to attach to a local mandate. I think we deserve sooner the better to attach that criteria. Thank you.
Thank you, Vice Mayor. And that reminded me of something which I will add. Speaking to the R0, because I've watched this since the inception now and watched the governor's press conferences every week when he was holding them every week. And R0 became a very important indicator that he latched onto rightfully, because it indicates the transmission of the virus and the rate of transmission. Now, when I think someone mentioned this tonight, when we started before the mask mandates, our R0, we were in the worst in the nation. We had real troubles, and we were really in trouble in June and July. And as this trend has dropped after he took actions, but all the mayors took actions, these numbers have dropped steadily, and our R0 now, is now one of the best. And we're about, somebody said 1, maybe that was Gina, but it needs to be below 1. It needs to be quite a bit below 1, really. But if we're going, one thing we have to realize is we are trying to attach these to any proclamation, is that this is what the state's watching too, in order to determine their understanding of whether we have an emergency situation or not, because these are the valid indicators. They are not the positivity rates, the number of cases, the number of hospitalizations. So we're all watching the same thing. And so it's very validating, and we can certainly integrate some of these into our decisions about the proclamation. I'll just say that I want everybody to understand that we are not the first, nor are we alone, because everyone is watching us. And in particular, I'm interested in those business benchmarks that are going from 10 to moderate, to get it down to a minimal state so that we can reopen more fully. So all of these things that are positive, I embrace. I think it's wonderful, and we want to keep them there, and we want to keep them going down. So that's all I have to say. And so we have a motion and a second to keep the mandate in force and review it at the end of October, at the second meeting in October. And is there any further discussion? If not, I would call for a roll call vote, please. Annie.
Mayor Miles?
Yes.
Vice Mayor Lingenfelter?
No.
Councilmember Mello Keener?
Yes.
Councilmember Nelson?
No.
Councilmember Staley?
Yes.
Councilmember Watkins?
Yes. Sorry, Eddie.
Councilmember Wade?
Yes.
Motion carries.
Thank you, Council. That was a very good discussion, and I think we covered a lot of territory, truly, and ended up in a good place. The next order of business is item 5B, resolution number 5302, authorizing the city manager to execute a grant agreement with the state of Arizona for distribution of federal financial assistance through the Arizona CARES Fund program. The $2 trillion CARES Act was signed into law by President Trump on Friday, March 27, 2020, and addressed numerous dislocations at the individual, corporate, state, and local levels across the country. One of the components of the CARES Act was the Coronavirus Relief Fund, CRF. The state of Arizona created the Arizona CARES Fund program to distribute $441 million from the governor's office to local governments with populations of 500,000 or less. The city of Kingman's allocation through the Arizona CARES Fund program is $3,560,496. Allowable reimbursable cost, pardon me, under the Arizona CARES Fund program are public safety and health employee salaries and employer-related expenses, i.e. benefits, taxes, retirement. Staff recommends approval and authorization for the city manager to sign the agreement. Manager Foggin.
Thank you, Mayor. I'm going to take about 45 minutes to cover this subject, so sit back. Just kidding. Actually, Miss Tina's got a very short presentation about this. It really boils down to us dotting the I's and crossing the T's so we can get our CARES money. Miss Tina. You're still on mute, Tina. You're still.
Thank you, Ms. Annie. There we go. Thank you so much, Mr. Foggin, and good evening, Mayor, Vice Mayor, and council members. So The mayor and Mr. Foggen covered really the summary for this particular item. It is about the distribution of our portion of the AZ Cares Fund program, which is $3.56 million. To finalize the distribution, we are required to enter into a grant agreement with the state of Arizona. And so resolution 5302 authorizes the city manager to sign such. We did submit public safety, meaning fire, police, and dispatch employee salaries and all of the employer related expenses for reimbursement, and met that by June 30th, and then requested reimbursement in early August, was approved for that in September, and now again, that final step is signing that grant agreement. So staff is recommending approval of resolution number 5302.
Thank you, Director Malouf. Are there any questions from council for Director Malouf? Comments? Is that off easy? Okay, then I would entertain a motion to approve resolution number 5302 and authorize the city manager to execute a grant agreement with the state of Arizona for distribution of the federal financial assistance through the Arizona Cares Fund program.
Mayor, I will make a motion for all of that.
Councilor Nelson, did you make?
Yes.
You move?
I'll make a motion. I'm not going to repeat all of that. Sorry.
No. That's why I read it. Do I have a second?
Second.
We have a motion and a second to approve resolution number 5302. Any discussion? All in favor, aye.
Aye.
Aye. Any opposed? Nay. Ayes have it. Motion carries unanimously. Our next order of business is a department report, a trails update. Manager Foggen.
Thank you, Mayor. We've had a couple of projects that we've been working on for trails, and one in particular for quite some time. And so in talking with Mr. Mearsman, it felt appropriate that we bring you up to speed on the one that I think we've been talking about since I've been here anyway. And then to also talk about another trail that has come into focal point in another part of the town. And so what I've done is basically invited Mike to walk you through where we are with trails. I think you'll find what he has to say pretty exciting. And we're happy about the progress that we're now making. We're not happy that it's taken this long, but I think we're going to see some great progress and an opportunity in the next couple of years to expand on trails pretty dramatically. So with that, Mike's going to walk you through a little presentation. So go ahead, Mike.
Thank you, Mayor and Council. It's been a long night, so I'll try to get through this pretty quickly, but I'm going to share my screen. I have a PowerPoint. Can you see that or no?
Not yet.
Well,
is that user error? And can you help?
Ike, if you want to email that to me real quick, I can share it for you.
Let me try to.
Oh, there you go.
How about right now? Can you see that now?
Turn it into a presentation.
Can you see it now?
Yes, sir.
All righty. So this is the trails update. Basically, I want to first of all talk about the White Cliffs Wagon Wheels Trail grant that was approved for $30,000 from Arizona State Parks and Trails, which we're really excited about. We got the approval to start, which is the big, most important thing that you get from Arizona State Parks. So, and that's scheduled for construction starting in November. And the total cost of that project is $1,000. Like I said, we're really excited about it, and we're excited to get the project started and get the construction going. So there's been a lot into it. Like Ron said, it's going to be an awesome project. Another project that we just completed that we're really excited about is we put a drinking fountain at the trailhead for White Cliffs Wagon Wheels Trail. It's an ADA fountain. It's got a bottle fill spout. It's got a dog watering bowl. It's just really a great improvement. I'd like to thank Rob Owen, Keelan Yarborough, and the water department for getting the water line hooked up quickly for us. And the parks team did a great job installing it and all the improvements that they've done there. Really proud of it. As part of the master plan, we've got to develop trail standards, which is an ongoing project. It's going to be a while. It's very detailed. We have to define best practices, trail planning, connectivity of trails, the visitor's experience, construction of the trails, the quality, the consistency and sustainability for long-term management of the trails, maintenance standards, protecting the resources, and landscape management. And part of that is the purpose of the trails. There's different kinds of trails. Signage and markers are very important. Road crossings are very important when you're talking about connecting areas of the city. And another very important part of it is trailhead standards. What kind of trailheads do you want? So the purpose of the trails, these are some of the different kinds. Barrier-free would be an ADA trail where people of all walks of life can go up there and it'd be more educational, which we would like to see one of these at White Cliffs Wagon Wheels where people could go up and view the wagon wheels. We think it'd be very, very good there. OHV trails, off-road vehicles and things like that. We've got them all around Kingman, obviously, and they're very important as well. Competitive tracks, multi-use trails, hiking, biking, horseback riding. They're all very important in our community. This is the barrier-free trail that we talked about where we'd like to get it so ADA accessible up to view the White Cliffs Wagon Wheels. We just think that would be a really nice addition. And the trail standards that we have to look at how we're going to build the switchbacks, the slope construction, this retaining walls, drainage structures, switchbacks, culvert pipes. There's just a lot that goes into the trail standards that in our master plan, they recommended that we set up our trail standards. So we're working on this right now. It's going to be a big project, but like I said, it's very important that we do things right going forward. Signage and markers are very important. On the right, there's the one that we put at White Cliffs Wagon Wheels, but we want to get these approved that these are the type of signs that we're going to utilize on all of our trails. Road crossings, another area that's very important. They should be avoided whenever they can be, but they're necessary when you're talking about connecting areas of our city to each other. And they should always be designed with safety in mind. The right-of-way should always go to the road traffic. The barriers and gates are going to be important when we talk about this. Some of the barriers would be boulders, and if we've got areas where there's cattle grazing, something like on the right there would be important to have fences like that built where people can walk through, but the cattle can't get through. So we've got a lot of important things to get through our trail standards. Another one that's very important is the trailhead standards. Do we want shade structures, drinking fountains, restrooms? Some of them will have utilities, some of them won't. Kiosks, very important. And some of them would be barrier-free facilities, which would be important if the trail has that ability to handle that kind of traffic. The size of trailhead facilities is very important with the carrying capacity of the trail. If it's for ATVs and horses, then you'll need a larger parking area for horse trailers and angle parking. And there again, the gates and barriers are very important. And obviously safety is the most important thing when you're talking about constructing, and also the maintenance is important. Another very important project would be the phase 2 of the White Cliffs Wagon Wheels Trail, which is in the blue there. It's 4 miles that was designed by the Ed Mann and the Colorado River Trail Alliance people, and we would like to pursue another grant to get that project done. Like I said, it's 4 miles and it goes above what the project that we're building in November. So it's a huge project, and it'd be another awesome addition to our city. Something else I've been working with Ed Mann and the Colorado River Trail Alliance group on is a trail trying to link downtown Kingman to the White Cliffs Wagon Wheels Trail area. We'd really like to see this trail, and this isn't exactly where it would be, but we're hoping to end up on 3rd Street, where people would head right downtown then after they did the trails on White Cliffs Wagon Wheels. So we think this is very important, and this would be a huge addition to our downtown. The highlighted properties in this area are all the ones that the city owns, and there's a area at the end of 4th Street there that could be a parking area and a trailhead possibly. It's a real beautiful hill, actually. So we feel like that could be a good starting point for the trail possibly. So we're evaluating all this right now, and a lot of work goes into that to see if it's going to work. You have to do a lot of calculations and everything to make sure the slopes are right for biking. So there's just a lot that goes into it, but we are working on this. Another project that's been talked about in a concept is utility easement trails, utilizing utility easements. The blue lines on this map are all of the Unisource utility easements, which would be great for linking areas of the city to each other. You could link downtown Kingman to uptown Kingman using some of these utility easements. The White Cliffs Wagon Wheels Trail to Beale Loop trails we think would be great. Wallapai Mountain County Park to downtown Kingman. There's utility easements that go in these areas that we could utilize. Sunbelt Park area, the East Branch area through Wallapai Foothills to Wallapai Mountain Road would be another project that's been talked about and would be a great addition. These are very involved projects though. It's not only the Unisource people that have the ability to tell you that you can do it or not. They're just giving you the rights to use it. You still have to get the buy-in from all of the property owners, which is a real challenge at times. So, but we feel like it's doable, and would it be a challenging project? Like I said, there's the land owned by city, by the county, state, Bureau of Land Management, many other property owners that would have to get buy-in to this project. And I've been in contact with Unisource about this, even the new leadership at Unisource, BLM, Mojave County, state lands. And so it's a project we're talking about, and like I said, it'd be very involved. It involves the landowners and stakeholders, all their legal departments. Agreements would have to be written, trail designed, construction, and something that they forget about a lot of time is the added cost of trail maintenance, which is very important. And with these trails, when you're utilizing the utility easements, if they need to get their big vehicles down the path, they're going to do it. So you have to keep that in mind with the trails that you're laying out there. They could be destroyed basically if there's a storm and it's wet and the big trucks have to run down there. They're going to wipe out the trail work that you've done. So there's just a lot of challenges that goes into this project, but it's something we're looking at and we're working at it. So I think that's about all I have for now. And I think it's been a long night, and I appreciate what all you guys have all done tonight. So thank you very much.
Thank you, Mr. Mearsman, and thank you for all you're doing and your team. These trails have been a priority of the city for so many years, and to see them coming into fruition and the planning for them, it's truly really very rewarding to see all that. Do any of the counselors have any questions or comments for Mr. Mearsman? I think everybody. Go ahead, Counselor.
I have a few things.
Okay.
First, I want to say thank you. Of course, I'm very excited about this trail finally moving forward. I know we've hit a lot of snags, but the community's been patiently waiting, and I know everyone's really excited about it. One of my questions was whether or not we're still looking at connecting this White Cliffs Trail eventually to the golf course so that there's access to it in the center of town.
The answer to that is absolutely we are, and we're actually applying for another grant to see if we can make that happen on somebody else's dime.
That's even better. I'm really glad to hear that. I think it's important that especially young people in the community are able to have easier access to our trails and even be able to get there on their own. So everybody that lives sort of in the center of town, I think that they could get there without having their parents take them out to one of the trails that are a little bit further. That's a really great, safe activity for our youth that we haven't really tapped into yet. One of the other questions that I had is about the new trail on the east side of town, which I've just started calling the Pennington Trail. I know it doesn't have a name yet, but that's who I always hear from about it. And I've had a lot of great conversations with Trav and Pennington about the trail, and that now KRMC is on board. They have Unisource as a partner, the county. And I just want to know if it's possible to have him present to the council the idea for the plan and the map, because I think people will be so excited. I've already talked to several doctors who live on that side of town. They love the idea of having this trail right through their backyard, because we don't have anything really on the east side unless you go up to the Wallapies, or if you're just riding dirt roads. So, could we get an early presentation in the near future just so everybody knows what's happening there?
Well, the answer is yes. I think really Mike's point to this is there's quite a bit of work that needs to be done to, at least from the city side, to use property that run what of course Mike referred to as the utility easement trail, and so that was kind of the purpose of sharing some of this information, is that Mike has been working those angles and trying, basically trying to get at least our piece of what that trail ultimately looks like feathered out or worked out, so that it, as these other folks, Mike pointed out, the county, BLM, as those folks do their part, that we're down the path. Is that too much? We're down the trail on this. But yeah, they're not a problem having the map, at least the concept talked about. Mike, did you have anything else to add to that?
Yeah, I've been involved with Travis about the project as well. And like I said, I've been in touch with BLM, the county, state lands, and we're all anxious about the project, but it is going to be a time-consuming project. And the city manager and I even, he braved with me and went on a truck ride out there to check it all out. And a lot of these trails are basically there already, but they're 2 tracks from along the utility easements and things like that. So they're there. And so, like I said, we've been working with all of them, and we're looking forward to this project. So
yeah, that's why I'd really like to get it previewed at the council, just because I know having that council support can really help to move it forward. And it is sort of already there. So if we could just make it official, we would have another trail. But again, thank you very much for all your efforts. This is a great advancement for our community.
Yep. And to finish that, we'll just, we'll look to have that in an upcoming council department report.
Thank you.
Yep.
I appreciate that also. I have a really nice copy of that map that Trevor left, and it is an exciting project. I think there are a lot of pieces for the city. My understanding is that we still have to discuss trailheads and maintenance and many things, but just conceptually, it's really cool. It's something I think the council could get excited about. Okay, thank you, Mr. Mearsman, appreciate it. We'll move to announcements by mayor, council members, and the city manager, Manager Foggen.
Thank you, Mayor. So I have a couple of things for everybody. First of all, I was handed a piece of paper and asked to share this information with everybody, and I think it's important. So voter registration information. So I need to point out that the last day to register to vote in the general election is October 5th, 2020. Of course, November 3rd, 2020 is the general election. The last day to request early voting ballot is October 23rd, and early voting begins October 7th and runs through October 30th. Want to remind everybody that you can register to vote at Mojave County Voter Registration. They're located at 700 West Beale Street here in Kingman, and online at www.servicearizona.com. Of course, as trying to help people, you can pick up voter registration forms here at City Hall. But just as a reminder, you cannot register at City Hall. That has to be done at the county. So that's that. Did I cover it, Annie? That was my assignment? Okay. And then just, of course, I've got to keep up the tradition of reporting on the 2020 census. We continue to be the 4th best in the state with just under 75% self-reported, which is dramatically higher than we were in 2010. And we are continuing to try to achieve the goal of 75% of self-reporting. And there are Census Bureau employees that are out checking addresses and verifying information and trying to collect additional data. So that is continuing to happen in our community. And then finally, just as a reminder, we have a ribbon cutting for our new playground at Cecil Davis Park at 9 a.m. tomorrow. And that park's located at 601 Van Buren. And Mike and his team have done a phenomenal job. And as a follow-up to that, the shade structure for Firefighters Park, which also has a very new playground in it, will be going up next week. So some good things happening in our parks. So that's what I have, Mayor.
Yay. Thank you, Manager Foggen. Councilor Watkins.
Yes, actually, Manager Foggen just mentioned it about the November 3rd, which means that's election day. We probably will not have city council. So it was inspired that Councilman Waite suggested that we discuss this earlier than later because it wouldn't have happened.
There you go.
Actually, we are scheduled to have a meeting that night.
We are.
Yes, sir.
Okay, because we didn't have one on the primary election, so that's what I was wondering. So okay, well, we'll still move forward, obviously, in all this. So once again, I appreciate all the citizens of Kingman and the input that we heard from them tonight. That's what else can I say? Thank you.
Thank you. Councilor Waite.
I have nothing to add. Thank you.
Thank you. Councilor Staley.
I have nothing else to add tonight. Thank you.
Councilor Nelson.
Oh my gosh, normally I get to say no, but I'm excited tonight. I have many things to share. Felicia in the HR department is phenomenal. So for anybody that knows her, she's just pretty awesome. She actually put together a beautiful city employee volunteer program that showed up at the Club for Youth the last week, and 2 different days. had people show up and just help there. The Club for Youth has actually been open this entire time. So every single time that a business had to close down and a parent had to go to work, or a parent was an essential employee, or school was closed, the Club for Youth was right there. And the Club for Youth said, we're open. We're going to take those kids. We can help them. And they help them do their tutoring. They help them do all of their, oh my gosh, seriously, that math wizardry that anybody had to deal with is pretty crazy. So I was amazed at all of that. And Annie's smiling at me. I know she understands the math wizardry that was going on there. Math class is not an easy thing for those of us that did the old school, because new school is a whole different world, just so you all know. But the city employees showed up this last week, and they honestly did a beautiful job. They helped paint. They helped put some carpeting down. They were great. My goodness, the city employees stepped up, and I'm just so thrilled with them. So I'm just excited, and thank you, because we have an amazing city staff. They do a great deal for us across this city. Thank you.
Thank you, Counselor. I agree with them and with the Club for Youth doing a great job for our citizens. Okay, Councilor Malakiner. Do we still have?
Nothing.
Oh, nothing. Okay, Vice Mayor Lingenfelter.
Thank you, Madam Mayor. I just want to say again, I just really appreciate the dialogue and the discussion that we had tonight. That's the way public policy is made, and I appreciate everybody. And the only other thing I want to mention is it was on our consent agenda, but for the public, you know, I want to give a shout out to the fact that we just approved the repaving of our main runway at our airport, and that's something to be applauded. Thank you.
Yes, it is. Thank you. I only have one thing to really announce, and it kind of also is an agenda item for the next council meeting. But today, well, last weekend today, I attended Mojave County Water Authority meetings. Many of you may know that the issue is regarding the transfer of Colorado River water, I think over 2,000 acre feet to Queen Creek. And we have always, of course, the river cities, and we in concert through the Water Authority have worked together to oppose this. But the Director of Water Resources in the state has made a recommendation to the Department of Interior to transfer about half of that, a little over 1,000 acre feet, from our river water to inlet to central Arizona. So our meetings have been about that, and today the Mojave County Water Authority, we passed a resolution opposing the transfer of this fourth priority Colorado River water, and also requested an environmental review, a full environmental review. So that resolution was passed. Other cities are Bullhead, Havasu, Parker are all putting this on their agenda or have already, and so is the county. And I've asked Manager Foggin to bring it to our next council meeting for us to also approve this resolution in support of our river cities and keeping the Colorado River water in serving our river communities. So that's that will be something on the next agenda. And really, that other than thanking Colleen again for her help in the video today, and also I want to thank Annie for helping make 2 videos in the past 2 days for the Arizona, for the Walk Away from Drugs events that we'll be having. One was for the City of Kingman, one for the Arizona Youth Partnership. And those are, again, something that normally we do personally at the events, but this year we're doing it virtually. So everybody is adapting, and I really appreciate it. Appreciate the help, Annie. So that's all I have. Are there any council requests for future reports and updates? Hearing none, I would entertain a motion to adjourn.
I'll move that we adjourn this meeting.
Thank you, Counselor Staley. Do I have a second? I think I heard a second. I want to thank everyone for everything tonight, for all the good discussion. Truly appreciate it. And I appreciate the public telling us what they think. And that's what we expect, and that we all benefit from that. So thank you. And good night. This meeting is adjourned.